You're gonna be the Derek, can you hear me? Derek, you should try to speak. So,
Hello.
yes. Okay.
Good morning, friends. Welcome to this inaugural medical mentorship session that we have today. You are all welcome. We're here in DLT and our online friends. Thank you for logging on at the time. We're going to get started. There's some small things that we're sorting out, but we can start and then we'll catch up with those later. So you are most welcome. My name is Ssinabulya. I'll be moderating the day together with the team of colleagues here with me and some who are online. So today we're going to start this with a word of prayer and then UCMF. UCMF is Uganda Medical Christian Fellowship, and several of us are affiliated to this. And the initiative actually came from UCMF to start this, how we can empower our medical, our interns as they start on this very important journey, be equipped with certain skill sets, but also want to change the way we experience our internship because it's so pivotal and it can create many things for us. There's so much. I hope the sound is getting better. Okay. Yes, we're working on that. Yeah, so Patrick, you're welcome to give us a prayer and the few remarks as we start with it.
Morning, dear friends, both those that are here physically and those that are tuned on online. You're welcome for this session, mentorship session for the interns. Let's open up with a word for prayer. Dear loving Father, we thank you for the gift of life. We thank you for the opportunity to sit together, to listen to words of wisdom, and better ourselves in the medical profession. We desire to be excellent in everything that we do. We desire to leave legacies that are worthy of who we've been called to be. We desire to glorify your name. We desire to offer the best of services to our patients, our clients, our communities, and the country at large. Now, Lord, as we listen to the words of wisdom from our elders, give us spirit of understanding, give us hearts that shall hearken to the words of wisdom, that we will run with them, that we will set out on the right foundation, and we will thrive in everything that we do. In Jesus' name, amen. My name is Dr. Patrick Wambuzi. I am a senior dental surgeon, married and a father of two, and I am the chairperson of the Uganda Christian Medical Fellowship. This morning, I welcome you to this session, our inaugural mentorship session for the interns. It is my honor to welcome the different dignitaries in your respective capacities that have graced this session, both physically and virtually, those that are online. Thank you for creating this time and being a part of this. In absentia, I would like to pass a vote of thanks to the Director General of Health Sciences, Director General of Health Services, and the team from the Ministry of Health. Thank you for all the support that you've given us to see this a success. Also, a vote of thanks to the Principal of the Makerere College of Health Sciences, Professor Nakanjago, for giving us permission to be in this place. Thank you so much. and also the Dean of Makerere College of Health Sciences, Professor Nachimuli. We will be joined by Dr. Katumba, who is the Registrar, the Uganda Medical and Dental Practitioners Council. Thank you so much, Dr. Katumba, for being a part of this. We also pass a vote of thanks to the Deputy Executive Director, Mulago National Referral Hospital, and the team from Mulago, all the directors of the different hospitals that act as sites for interns. Thank you for allowing the interns to join us this morning. So administrators and all the director, thank you so much. The organizing team, the Uganda Christian Medical Fellowship, and all the panelists that have created time to be a part of this and bless the young ones. WUMA, the Uganda Medical Association, your absentia, we thank you for whatever support you've given us. The leaders of interns, the president and your executive, thank you for the great work done, for mobilizing the interns to be a part of this session, and all the other guests that have been invited. One of our objectives as the Uganda Christian Medical Fellowship is to collaborate with other stakeholders to make sure that we have standards, in the medical profession, and train and make sure that whoever comes out or whoever is in service offers the very best. Allow me to say something short about the UCMF. The Uganda Christian Medical Fellowship is a non-governmental organization that brings together all the Christian doctors, all the Christian medical professionals across the country. That includes the medical doctors, the dental surgeons, the nurses, and the pharmacists. And that objective that I alluded to earlier is the very reason why we are here. And the theme of this inaugural mentorship session is thriving in the medical profession, laying the right foundation. We are here to speak to the young ones, both those that are outgoing interns and those that are incoming interns, the pre-interns, but also we are here to speak to one another, to spur one another and to good works and excellency in our profession. We are here to mentor, we are here to teach, we are here to train, nurture, nourish, encourage, motivate, inspire the young ones to unlock the greatness that is in the inside of them, that as they set out in their careers, they set out right on the right foundation. And there's no better way to do that than to listen to men and women who will give us the words of wisdom this morning, the men and women that have been there, that have built legacies in this profession, that have built reputations in this profession, and we desire to hear their words of wisdom that may do even much better than them. Dear interns, those that are outgoing and those that are incoming, you have a noble call upon your lives. And this morning, allow me to draw that call that's upon you from the words of Jesus. John chapter 14, verse 12. Most assuredly, I say to you, he who believes in me, the works that I do, he will do also, and greater works than this he will do, because I go to my Father. Jesus Christ had disciples. He mentored them, he trained them, he taught them to carry on the ministry, And he believed that being a successful discipler is to disciple men and women to be greater than himself. Seated here, and those that will be seeing on the panel speaking to us in our different areas where we are, those that will be here virtually, and those that will be speaking online, the men and women that have built legacies and reputations in their respective fields. Hold on to the words of wisdom that will be spoken to us this morning, because the call upon the younger generation, the call upon the interns is greater and tougher. The call upon you, dear friends, is to build legacies and reputations that are greater than ours, that are greater than your predecessors, to build hospitals that are greater and to do greater works. The true mark of success for any leader is to mentor, disciple, train, and teach in order to raise leaders that are better, that are greater than self. Mentees, intern doctors, and everybody that is listening to this session, our desire is to see you become better in everything that you do, better than the great of this nation in our profession. Therefore, it is the cry of our hearts that you supersede us in everything that you do. It's our desire that you become the best surgeons in the country. It is our desire that you become the best physicians in the country, the best pediatricians, the best obstetricians, the best dental surgeons, the best nurses, the best pharmacists, the best that this country can ever have. And that's why we're here to give our very best to the young ones to become what they purpose to be. We believe in you, and we know that you can make it. Believe in yourself and purpose to be the person that you choose to be. Thriving in the medical profession, laying the right foundation. No hands but yours. No feet but yours. Have a blessed session.
Thank you so much for and what friends, you are welcome once again. Allow me to take this opportunity to introduce Enock Tayebwa, who is a medical officer and is transitioning through the hierarchy to take on the next level. But he's a young and energized workman. I completed his studies to Makerere College of Health Sciences in 2017. Pre-internship, participated in several things that really grounded him. The sickle cell clinic, pediatric ward. Did his internship in Gango, Katumba, and then also part of it was done in Lago. After internship, he went to Windi Community Hospital for 2 years. And not actually at all his levels, he was an excellent doctor, was an excellent intern, one of the best during their times. And what we gather from where he's been working, he has maintained that excellency. Currently, he's working at Lago. In a few weeks or months, he's going to be starting his surgical residency. He's part of the UCMF committee, and he mobilizes us in several aspects. Enock, you're welcome to speak to.
Thank you very much. Thank you very much, Dr. Isaac, for that very generous introduction. I'll not add anything. I might spoil things. Yes. Yes, I have a small presentation. Just have it set up here. And thank you very much for being part of this. We never had this for our lots. We just went out to our internship sites. And certainly we encountered a number of challenges here and there, which I believe a word of wisdom would have actually abated, would not have had to go through certain things. Sometimes we go through some hard situations just because we did not hear certain words. So thank you very much, Edward. All right, so I'm just going to be quick because our time is a bit spent. So I'm just going to talk about getting started. Well, as an intern, how does one get started? We want to see the who's, the how's, and the what's, and how they are really very important in this journey that one who is doing internship or who is about to start internship needs to take note of. Then I thought this is important. It's a disclaimer and a disclosure. I've not been given any financial incentive, or I don't have any political motive, or I've not been given any incentive to make the presentation I'm making. So please don't think that I'm speaking for any politician or I'm trying to push a certain agenda. This is just a heart-to-heart sharing on how to make internship a worthwhile experience for yourself and for the patients that you'll be seeing during that course of time. All right, so as an intern, there are many hats that you're going to wear. There are many responsibilities that you're going to have to take on. As a matter of fact, these are given to you by virtue of just being an intern doctor. So, of which some is being a medical professional. That's what you've been doing. You've been studying for all these years. And then certainly now is the time to make use of that knowledge that you've been accumulating in class. You'll have to be a communicator in many aspects, speaking to your colleagues, speaking to your seniors, speaking to your patients. So as a matter of fact, you can't claim to be a poor communicator or an introvert who doesn't speak. You'll be required to be a communicator as a doctor. Then a collaborator, yes, you'll have to collaborate in many ways. There are things that you can't do for yourself. An X-ray, you can't do it for yourself. Some labs, you can't do them for yourself. So you need to know who to contact. You need to know who to collaborate with to make sure that these things are done. Then you'll be an advocate also. Yes, that there will be patients that you'll have on the ward, say, who don't have the money to do some investigations. If you have the ability to look for a waiver for them, you advocate for them in that sense. Many ways of advocacy, but that's just one of them. You'll be a teacher. So at this point in time, you'll certainly have people who are like you now, the students who are in 4th year, 3rd year, 5th year. So at this point in time, you've already been given that responsibility. You'll be a manager, you'll be managing resources on the ward. There are many things on the ward that you need to take account for, make sure that they are being used correctly and they are available for use. Make sure there's a BP machine and all these things. So you will have to manage the items and even individuals. So there are people that you'll actually have to manage, and that brings in the aspect of leadership. So you'll be required to have leadership skills. So all these things are put on you the moment you begin your work as an intern doctor. So as a matter of fact, these responsibilities are given you regardless of whether you want them or not. So we're just going to look at how do we actually do this? How should one try to move through this journey? And so I'm giving you a word of one who has been through this journey. I've been there. So I want to just share with you a few of my experiences, a few of the things that I feel would make this journey a little tolerable. All right, so these are very important parts for you to take note of. Introduction, always introduce yourself. when you begin in this new place, because you're starting in a new place for the pre-interns. Then for those who are already in internship, yes, you're already ongoing, but important to always introduce yourself in a place that you're starting, to your supervisors, to the clinical team that you're going to work with, the nurses, the doctors, the pharmacists. One has to make sure that they introduce themselves to all these team members, to your work colleagues, whether it be the cleaner. It's very important that you introduce yourself. At times, we feel that we can operate as an island, but I will assure you, medicine in itself requires you to be a team player as much as possible. So you need to create the rapport from the very beginning. To the patients, yes, always important that you introduce yourself to the patients and their attendants on each encounter that you have with them. So this is just something that I request you to take note of. Always introduce yourself. I'll just maybe give you just a scenario. On the ward where I'm working currently, I made it an effort to introduce myself to everyone, including the cleaners. So I know them by name, they know me by name. So occasionally I don't have time to go look for food. So at times they bring the food up there. And they're always keen to make sure that I've actually had my meal. They'll come and look for me and say, have you had your meal? Your meal is ready. Something like that. So by the time you make such friendships, you find life easier. So I probably won't miss a meal because someone is looking out for me, rather than trying to operate like an island and feel that I can't interact with this person, but they can help you in their own way and in their own right. So that's very important. Create rapport from the very beginning. Find out who is who. That's very important. I believe that's self-explanatory in itself. Find out where the services are, with the pharmacy, where's the laboratory, where's the blood bank. Find out those things from the very beginning, from the very word go. It's easy for you to get to know these things when you're finishing your internship, and that would be a bit sad. So find out what is expected of you. That's very important. You have your supervisor on the ward. Find out what is the expectation of you. What do they want you to achieve in the end, or what are the core achievements you must have by the end of your placement on a particular ward. That goes a long way. Even to the supervisor, they will really know that you are an individual who's up to the task. Then find out when, how, and where to get support. This is very important. You'll be overwhelmed at times. You'll have challenges here and there. Please find out which individuals you can actually reach out to, and they'll accord you the help. People are always willing to help, but you need to know where to get the help from. Then, as I've already mentioned, the medical practice in itself is more of a team effort. It's always team effort, I'll assure you. Acting alone, you'll break down. You'll be very tired and you'll not enjoy what you're doing. So your team members, know them, know their roles, okay? And know how to contact your team members. So at times, if you say you're on a particular ward, I've seen it, you've done that, you have a WhatsApp group so that you can always communicate amongst yourselves. Let others know how to contact you, very important. Always be available. Don't go switch off your phone and people can't reach you when probably there's something very important they need to ask you. At times, it's a matter of life and death. Yeah, that's very important that we've been given this responsibility of life and death at times. So at times you might be the one with an answer to save someone's life. So very important that we make ourselves available. Let people know how to contact you and not on the ward. Your contact should be readily available, and if it will be off, kindly inform people so that they know, or even know how to contact you still. Yes, then duty allocation. Yes, you'll do this. Of course, you'll have to do this while on the ward. Who's doing what and who's doing it when. That's very important so that everybody knows their responsibilities and tasks. Be accountable to each other within the team. Very important. Always be accountable. If you're supposed to do something and you didn't do it, tell the person who's coming in after you. Okay? So that's very important. When you account to other individuals, they also account to you. Of course, they easily reciprocate what you're actually doing with them. Always receive and give feedback respectfully. Of course, there will be challenges here and there. We have different work ethics. So very important, if someone gives you feedback and it is indeed positive, receive it. And if, of course, one of the team members is lagging behind, respectfully give them feedback also, so that they can improve and you're able to be of service to the people you're serving. Yes, and always hand over and receive patients, always very important, especially if they are critically ill patients, always hand over and make sure that you receive. Ask the person who's going before you, are there any patients of concern that I need to take note of or responsibility for? Then, yes, about the patient handover. So that one is a very, very important aspect, okay? Always receive and always give the handover. And give a brief summary about the patient. Who's the patient and what are we treating the current condition? What are the immediate goals, say, of the care, and what time should we do that particular care? And what are the overall goals of care and the timing? So that's very important that we always hand over to each other. We know what the previous team is aiming for, so that you also fit in and also aim for the same. Otherwise, it is very easy to find that maybe the plan was to do an investigation, a particular investigation the next day, and then for you, you're saying, no, we discharge them the next day. It's always very important that you are all in sync with the plans that you have for your patients on the ward. Yeah, I'll encourage you to know your patients, know all your patients. So this will be very easy. Even as you hand over, you know which patient you're talking about. And I would encourage you not to know patients as conditions, know them as individuals. This is someone's father, someone's brother, someone's mother, someone's sister, someone's child. So don't say the hernia in the corner. Don't say the cellulitis, the interception on bed 2. That's not how we refer to people. Those are individuals, please. So it's very important we know them. These are people that you can actually relate with. You could also be on that bed. I don't think you want to be known as the Dr. Ricky has a number of those. Yes, you don't want to be known as the boil or the cellulitis on a particular bed. So please, let's know these individuals by name, or at least if you do, at least know them by their profession, at least know them by something about them, the father of 5, that's fine, okay? At least these are individuals that you're putting a person to this individual. You're looking at the humane bit or the humane side of this individual. Then I'll talk about consultation. So even now, even as we do internship, it's very important that you consult as much as possible. Consultation is very key, and I can assure you, the senior doctors are always very willing to give you guidance. I've never seen any senior doctor that is not willing to give you guidance when you ask for it. Ask for it, ask questions. They'll be very willing to answer you because they know that at some point you'll be the one to take responsibility, probably for their relatives or even for them. So it's very important that you ask for, you consult. Don't think that you'll probably die in your own movie or you'll try things your own way. That's not right, because there are people who have gone before you, they've already tested the things, they know what works. So always consult, that's very important, okay? So it even builds teamwork, even builds a relationship with you. I've actually seen this, it's very true that for the consultants, the seniors I've worked with, the more I consult them, the more we bond, the more we build a relationship. And I'll tell you that I've gotten a number of things because of this consultation. I found it very easy to find people to recommend me for the master's program because of the consultation I had with these individuals. So that's very important. So paperwork, very important. We have all these documents on the ward. So it's very, very important that you fill them as they should be. Make sure that you fill all the details as they should be. That's very important. Then importantly, I'll encourage you to explain to the patients. Be willing to explain to them about their condition. I've seen a number of patients who come and they were admitted, say the previous week, and they don't know what they were admitted for. Really, that's very unfortunate. Well, at times they will not have their discharge note. Well, a number of them usually say fire burnt the house. I don't know why. It seems to be a number of them have fire outbreaks at home and the discharge forms are burnt. But whatever the case, let's always share with the patients in a language they understand what condition they have. and what we are trying to do. And if we are stuck, we tell them what exactly is happening to them or what plans we have. I really encourage us to do that. Imagine you are the one and nobody's willing to give information about what your ailment is. Okay, so needless to say, all these things are very important. Always, yes, write your name and signature and the designation after you've written your notes. That's always very important. Maybe Dr. Katumba will hint on that at some point, but it's a very important thing. Yeah, because it might have even medical legal implications. At times, these are things that you don't see often, but when it happens to you, it can be distressing, really distressing. So all these forms, the medical reports, the progress notes, very important. Write the name on top, because these papers easily fly off the file. Discharge forms, fill all the fields. I usually see individuals who just write a few things here and there and not give you all the details about the patient in that discharge note. We've done a number of investigations. They remain at the facility, and this patient will go to another facility, and then they'll be required to do the same investigations again, just because we didn't take time to note down some of these important aspects. Yes, the transfer notes and the consent forms. Prescription, yes, very important. The prescriptions are very important. It's a skill that you'll keep learning over time. That, of course, of course, we know about the antibiotic resistance. You know when to give and when not to give certain drugs. So, very important to know why you're prescribing a particular drug, when to prescribe it, and what to prescribe for every particular condition that you have. So important that even as you write the prescription, you write it as it should be. The name, the doses, cross-check if you're not sure. Please just cross-check. It's not a law that you must have it on your head. At times, you may not remember some of the things. Please cross-check. It's worse if you give a wrong dosage than because I don't think there is shame in you checking if I'm making sure that you're getting the right dosage. Okay, so you'll be like, I don't want to look funny before my patient because I'm cross-checking, and then you'll kill them. I think that's worse. Okay, yeah, there are drugs that really would cause issues if you give a high dose, and certainly there are some pharmacies where they don't mind to cross-check the prescription you've given, and then they'll just follow the drug. Maybe they may even die from home when you don't know. But I think may your conscience remind you to actually cross-check. Yes, the right formulation, that's, yes, very important. Make sure that you note that. Then there's this notion of saying, let's say, taking a drug 8 hourly or TDS. Oh, yes, TDS. TDS might mean that it's not strictly 8 hourly, okay? So you need to be sure if you want a drug to be taken every 8 hours, make sure that it is. Then yes, there's a blood transfusion forms, make sure that you fill them. That's what we've been talking about, not the time of start and the time of ending. Then the labs, always ask yourself, why am I asking for this particular test? Why am I requesting for this test? Don't ask for tests just for the sake of treating yourself. At times, medical personnel will treat themselves by just asking for investigation to show that they are doing something. But make sure you know why you're expecting, you're asking for a particular test. Well, I have a lot to say, but I think I'll just skip some things. Dressing code, this is needless to say. I'll tell you that the patients or the people you work with judge you based on how you're dressed. Even before you speak to them, they will already make a conclusion about you, just depending on how you're dressing. So always very important that you don't kill that first impression with the people you will always meet. So I remind you about the hats you should always wear. Very important. Make sure that you take responsibility for all these responsibilities you've been given. They will all be given to you, whether you like it or not. These are things you must take on as an intern doctor and then going on to be a professional in this field. Yes. Then, of course, I just had some advice that write, very important that you write. Create a portfolio of the things that you do on the ward, of the cases that you see. I've seen a number of people with fond memories of the particular cases they saw during their internship. And this at times helps you actually to reflect. As you write, you reflect. This has helped me a lot. I usually read my internship portfolios with nostalgia when maybe occasionally when I sit down to read them. I just have that remembrance of how that period was and the things that I learned during that period. And you're able to reflect as you write. Whenever you write, you reflect. And that helps you not to do the same mistake that you did the following time. It helps you think, how could I have done better if a patient died? Yes, I have a portfolio of the patients that I've lost. And I ask myself, what could I have done better? And I've seen it help me do better subsequently. Thank you very much. I'll stop there for now. Yes.
Thank you so much, Enock. He has given it that fresh spice. So for those who are starting internship in a few weeks to months, please take notes. And then those who are winding up, it's never too late. These are aspects that you learn. Yeah, so stop sharing here. So our next presenter, you can help me project the next presenter, Dr. Sabrina Bakeera. She's a pediatrician, a very passionate pediatrician. She almost made me change my mind about internal medicine. It was that attractive. She's so passionate and energized. Whatever she does it with passion. She's a senior lecturer with the College of Health Sciences, Department of yes. She's a patient advocate. She's also a staff advocate. She has advocated for students. She has advocated for many people, and she's very energetic. That's what she does. Dr. Bakeera, please speak to these young people. And we also take notes, some of us don't know. Thank you.
Good morning. I hope you can hear me. Okay, thank you very much. I'd like to thank the UCMF leadership for inviting me to be part of this exciting workshop. And particularly, I'd like to thank Dr. Prosi Mugaba, who should be sleeping right now, but she's awake in Canada and listening to all of us. I'd also like to thank Dr. Isaac and Dr. Tayebwa, who has spoken before me. I'm sorry I couldn't come physically, but I hope that the slides I share will make sense to all of you. Please allow me to turn off my video so that I can concentrate on the slides. So I chose to talk about striving for excellence and not perfection. We know that excellence is a skill, and it's not a skill, it's an attitude. And it's very important for all of us to focus on progress and not perfection. In Maslow's hierarchy of needs, on the top of this pyramid is self-actualization. It deals with building of your career. Below it is self-esteem, then belonging needs. Who are your work friends? How do you survive in a positive setting? And then there are security needs. As interns, you're going to be posted to wherever, including Maracha, Kampala, and sometimes you'll find that there's insecurity wherever you go. But also you need to cater for your physiological needs. Whereas these are at the bottom of Maslow's hierarchy of needs, there's this big thing called salary. You need a salary to survive. And year in, year out, there's been a strike of the interns because of salary. I hope this year we don't get interns striking because of salary, because you've had a big raise in the last few months. There's also an interesting hierarchy of needs on this side. Of course, self-actualization. When you join internship, you get inspired by your seniors, you want to become the best pediatrician, you want to become the best physician or surgeon. But self-esteem is so important. Dear ladies and gentlemen, dear colleagues, the first impression really matters. If you don't impress the people you're working with on your ward, then you're very unlikely to get that recommendation that Dr. Tayebwa talked about. You need to have love and belonging, safety, physiological needs. But now this hierarchy of needs also includes Wi-Fi and your battery. Like you heard constantly, you need to have a phone that is functional. So please invest in a phone that really works. You need to communicate with your seniors, with your juniors, but you also need to take interesting photographs. But don't get hooked onto your phone. I've seen interns, instead of working, they are busy laughing at TikTok videos, and it becomes very destructive. Now there's a guide to doctor hierarchy. You've known that when you're a medical student, a third-year medical student, you report to the fifth-year medical student, the fifth-year medical student reports to their intern, the intern reports to the SHO, SHO reports to the resident, etc. like that. It's so important for us to follow this hierarchy, and it just didn't start out of the blue. This hierarchy of medicine started because of the history of medicine. Long time ago, medicine was an apprenticeship. It's still an apprenticeship. However, now we know it's mostly educational, but doctors continue to have this hierarchy. If I was a medical student and my current colleague, who is now a senior consultant, was my teacher, I will always treat him like my former teacher. And there's no way he will come on the ward to do a ward round and then I'll be competing with him for patients because he taught me. It's so important for us to have that level of respect for each other because it is our culture. It is our culture as doctors, and it's important for all of us to follow it. On the other hand, I hope that the people who are supervising you will not be bullies, that they will not be showing you that you're their slaves, because it is teamwork. I want us to reflect on Proverbs 15:32-33, that a gentle answer turns away wrath. He who ignores discipline despises himself, but whoever heeds correction gains understanding. The quick summary of this verse shows, when you're an intern, when you're a junior, do not try to argue with the seniors. And if you're corrected, take it in good stride because people are trying to teach you. And Proverbs 15:33 says, the fear of the Lord is the instruction of wisdom, and humility comes before honor. Wherever you are, whatever you do, start with a prayer and let the Lord guide you in whatever you're going to do. So back to this thing of perfectionism, we know that perfectionists lay very high and inflexible standards. And a lot of doctors, we are brilliant, we are high achievers, we want excellent standards. But sometimes you find yourself in a place, you're working, and whereas you want high standards, certain things are not there. That is where your flexibility should come in. Can you look for a special way to get medicine for your patients without creating havoc or disharmony? And then what is excellence? Excellence is the quality of being outstanding or extremely good. And it is so important for us to push for excellence. Let us push for excellence. Let us, right from the beginning, plan to be excellent at whatever we do. Let us promote good quality, capability, and even maturity in whatever we are doing. We have learned a lot during our course in medical school, and so we must ensure that we deliver outstanding outcomes. These outcomes include the best outcome for our patient, the best teamwork, the best relationship with whomever we are dealing with. And excellence is never an accident. It is always the result of high intention, sincere effort, intelligent execution. It represents the wise choice of many alternatives. And I insist, it is choice, not chance. And it determines your destiny. When you start your internship, you're determining your destiny. Are you going to be recommended when you want to come back for your residency? Are you going to be recommended when you're looking for a job? And obviously, excellence includes a lot of things. It includes competence, good communication, exchanging ideas, motivating each other, being motivated, having a vision. It's so important for you to plan. As you start your internship, don't stop at just starting your internship. Make a plan, a 3-year plan, make a plan, a 1-month plan, but always make a plan, even a daily plan. What cases am I going to follow up today? What investigations do I need to do so that you are always seen in an excellent light? Becoming excellent is not automatic. Start with being good, and then aim to be better, and then you'll be the best. And don't try to compete with fellow interns. I know that not all of us can be the group leader. We cannot always be the intern president, but we can be part of the committee. We can be part of the team that leads on that day. So let us always aim for the best, but don't let best be the enemy of good. I have always said that medical hierarchy is like the military. Look up to the people in front of you, but always promote teamwork. Everyone can teach you on the ward, even the cleaner. So respect is so important, and being humble helps you to go far. I'm very proud to say that we now have an adolescent clinic, and it started in a small way, but adolescents are our future. Dear interns, dear colleagues, these people are aged between 10 and 19 years. And even if you seem to be on the bottom of the hierarchy right now, remember, you have medical students who you can teach, you have medical students who you can inspire. So don't be that intern who comes shabbily dressed on the ward. Do not be that intern who is not willing to share information with the juniors. And learn to refer appropriately. You cannot manage everything. If you cannot do it, please consult and refer. There are certain tips I want to share with you. Take responsibility of yourself. Don't blame everything that goes on wrong because of other people, because of other circumstances. Don't get angry, for heaven's sake. Do not get angry with your patients. Do not get angry with your leaders. Try to show kindness and respect to other people. Perfectionism has no room for wrong impressions. It has no compassion for mistakes. But perfectionism is not real, so we should aim for excellence. You're going to work as a team, and that team includes the entire ward. When I joined internship, I did my internship so many years ago. My supervisor said to us, interns work for 24 hours, interns don't sleep, interns don't shower. That was strange. And we understood that interns are always on the floor, and we worked. And there's a time during my internship that I worked for 36 hours nonstop. I was in the theater assisting and doing operation after operation, operation after operation. And then I realized that I hadn't eaten a proper meal. I'd only washed my face and some parts. And I started to get frustrated after the 36th hour. And so I called my immediate supervisor and said, I cannot go on. Please call for help. If you're stuck, please call for help if you feel that you cannot continue. I have seen interns fainting in acute care units because they want to do the best for their patients. Remember the hierarchy and the pyramid. You have to take care of yourself before you take care of others. Remember to eat. Remember to go away and debulk the stress and the entire situation, because you can't keep working like a computer. So I have said perfection is unreal. It's actually the enemy of progress. And even as we move towards progression, we must get people to support us to be the best that we can. When you're an intern, it doesn't mean you have stopped to read. Please pick up your Hutchison and always refer to it and read it judiciously. After your Bible, read your Hutchison. There are certain tips that I'd like to share with you to stop your perfection attitude. I know that doctors, we want to be perfect in everything we do, but if you're not perfect, keep trying. Don't forget that you should also exercise, eat a balanced diet, sleep enough whenever you can, and dress appropriately. You don't have to dress to kill and don't have to wear expensive clothes like, as about to say some of us. You can wear clothes that fit you properly. You can wear a clean tie. You can wear decent shoes, and they all don't have to be expensive. You can look for places to buy clothes that fit you properly and which you can afford at this time. 20 years from now, you'll probably be buying from dazzling stores on the 5th Avenue of New York. You'll get there. Don't panic. So we need to build resilience. We've gone through a lot, COVID, there are so many challenges, but it's important for you to learn how to relax, learn how to breathe, take a deep breath, be grateful to God that you can actually breathe, and present gratitude and social interaction. Social interaction does not mean go for every single party, go for night prayers, and neglect your work. Because remember, internship is just a year of supervised work. And after that, you're free to do whatever you want. Don't forget that COVID is real and COVID is continuing. We are not about to say that COVID has ended like a magical wand. And there are many variants of concern. You have to be cognizant of your own protection. Please double mask. Please double mask. For those of you who haven't yet been vaccinated, get your vaccines as soon as possible because you are on the front line. So what is resilience? Resilience is our ability to deal with change, changing from being a medical student to becoming an intern, to becoming the person responsible for the acute care unit, for the emergency service, for the casualty department where you're the one resuscitating and not observing the resuscitation. It takes a lot of challenge, but you will overcome, you will manage. Resilience is something you can build up. It's also something you need to maintain. I always tell interns that whatever you go through during your internship is going to determine your career. How you are treated, how you're working hard to save that one patient is going to determine how you work for the rest of your life. So building personal resilience means before you consider building resilience in those around you, please look inwardly, look at yourself and build your own personal resilience. Learn to relax. Like I've said, learn how to breathe, breathe in, breathe out. Learn to relax. You can listen to music when you get to your home. You can learn how to sing in your bathroom. You can pray and read your Bible, read your Quran, and also make sure you schedule in relaxation in your busy schedule. Time management is of essence. Please get organized right now. Get structured, set short-term goals, set long-term goals, and use a planner. I already mentioned, write down. Go and buy yourself a notebook or an organizational planner so that you are on course with what we are talking about today. I'm going to share with you my personal first aid kit. I've always shared it. And the first one is ask for what you want. Be who you say you are. If you're a member of the Uganda Christian Medical Fellowship, truly practice what you believe. And then care about others. And finally, dare to live your dream. Like Joyce Meyer said, strive for excellence, not perfection, because we don't live in a perfect world. I just wanted to share with you that amidst my busy schedule, etc., I wrote a book, and I hope that one day each of you will be able to read this book. It's called The Real Pursuit of Excellence, The Threads That Keep Us Going. Once again, I'd like to thank the UCMF sincerely for putting up this workshop and giving me the opportunity to share with our incoming interns. Thank you very much.
Thank you so much. Thank you so much, Dr. Sabrina. Always inspired many of us for taking notes, for learning. Thank you for being excellent all through. Yes, lots of lessons learning there. As an intern or pre-intern, you need to position yourself to be able to tap. Because even as we pursue this, we're thinking about career, and it depends on how positioned you are to enjoy that career path. Sometimes there are lots of things around us that will cause us to complain, but seize every opportunity. Some challenges actually can be opportunities to help you step up. I remember I did my internship several years ago, and I was in casualty. That time there was a cholera outbreak. I had never seen dehydration in that June. Those of you who make chapati, you pull the skin and you can actually write your name on somebody's skin. That was dehydration. In an adult, I had seen something close to that in pediatrics, but in an adult, to have that dehydration was a rare thing. And thank God we got access. We pushed in fluids, and I was ending my rotation in casualty and going to ID mail the next day. For some good chance, I found the patient the next day as I was starting my rotation on ID. And the guy was seated up, talking, and demanding to be discharged. I said, wow, fluids, wow. And I thank the nurses that gave me the courage, because I had given up actually. I said, how do you remind sir? I said, doctor, you can do it. So position yourself to learn from every opportunity. Those nurses in there, they've seen so much, and they can actually encourage you to press on where you want to give up. Little did I know that I was being set up for bigger things. I managed these patients. I would wake up in the night sometimes and just check on them. And if I knew it, there was an advert for somebody to coordinate where you come. And all the nurses were saying, why did you put out an advert, yet we have an intern doctor who can be our boss? Yet the task ahead actually was for somebody, not an intern. They were looking for a physician. To cut the long story short, I was awarded the job to coordinate that. But it started with somebody inspiring me to take charge and do something. And then when I saw results, the results motivated me to do more. Before I knew it, I was an expert in putting up lines. I had an opportunity to manage, because I was, as an intern, I was able to employ, like my colleagues who are going for leave. I'll tell them, going for leave, you can come and make some money, please come. And they earned, but it primed me to be a leader, even at that young age. But the courage and the confidence that was inspired through the nurses, it was really, really amazing. And this elevated me and opened doors that even after internship, people will recall and just call you, Isaac, where are you? We want to offer you a job. Yeah, so sometimes the challenge can be flipped into an opportunity. Many things can be around you and it's dictating for you to switch off. But ask for that extra grace and that extra energy. Step in, do what you can. Don't go overboard. We don't want you to collapse. But where there is energy, call for help, peer support. Many times we know who is good at what. When you are troubled, call for that help and people will be able to help you and actually sort you. Yeah, so it's an amazing process. As people are speaking, I'm reflecting, and the memories are coming alive of how we enjoyed some of these things. And don't approach it as a huge challenge. Yes, Dr. Baka was told that 36 hours, 24 hours, no nothing. Please mute if your phone is on. Just mute your phone. Yeah, but you realize that actually it's not a way to scare you, but it's a lot of. Yeah, but we seize the opportunity such that we're able to actually shine. Yeah, so allow me invite the next panelist, Dr. Reverend Richard Yaruhanga. He has mentored many of us in many aspects. Such a great inspiration when we were in medical school. So much energized that you would not even predict any impossibility. Whatever you decide to do, he will do it. You go to him for help, and actually you'll be inspired and you feel refreshed. In moments of challenges, he was a go-to. And actually, even we once in a while run and helps us. So he's an ENT surgeon, senior lecturer and head of ENT, UCU, School of Medicine. Areas of specialization include endoscopic sinus and basal skull surgery. He's born again, he's an ordained Anglican priest in Kampala Diocese. He's an entrepreneur. He's married for the last 16 years, faithfully blessing many people and blessed with 5 sons. Dr. Yaruhanga, you're welcome to speak to us.
Thank you, Dr. Isaac. Good morning, ladies and gentlemen. Those physically here and those on who are virtual. Happy New Year. I'm glad to be here. I'm glad to be a part of what UCMF is doing, and I'm grateful to the UCMF leadership, Dr. Wambuzi and the entire team. Thank you for organizing this. Like one said, we never had this our time. But it's a joy to be a part of what's going on. Dr. Isaac, thank you for the introduction. You have, I think you've said it all. I'll not go so much into that. I'm going to talk very briefly about finances and personal welfare. And because of the time that we have, which is short, I'm just going to share a few things, but from my personal experience, the things that I've learned over time. And so some things I've learned by experience, by reading and things like that. Let me start by saying that going through medical school, there are certain realities that you see. Number one, very few of our lecturers, they teach us to be good doctors, which is a good thing. They teach us to be excellent doctors, excellent clinicians, nurses, dentists, mention it. And that's a good thing. But you know what? There are harsh realities that when you get into the field, you are faced with money. Either the lack of it or the accumulation of it and what to do with it. Number two, the other harsh reality I realized shortly after internship is that many of us cannot afford to be treated in the hospitals we work in. I repeat, many of us cannot afford to be treated, especially if you're working in some of the private health units, not government, because with government, most times it's fairly free of charge in terms of treatment. So many of us cannot afford this. And so friends, we cannot run away from money. We cannot run away from the issue of what? Of money. And some of my experience comes from my upbringing. I grew up in what we call poverty. I grew up, I tell friends that all my growing up, we're living with my parents. We had never lived in a house which was beyond 2 rooms. I'm not talking about 2 bedrooms. 2 rooms, where one room is the bedroom for the parents, stroke store, stroke last born sleeping there, stroke, and then the other one is sitting room, dining room, stroke bedroom, stroke visitors room, stroke kitchen in the night. Hallelujah. That's interesting, huh? Now, with that background, I faced what poverty was, and it kind of shaped my thinking. And so when I got a chance to get to school, to medical school, through secondary school and medical school, I worked hard at it. But one of my motivations was I hated poverty. I still do. I still hate poverty with a passion, because of what I went through. I don't want to go through it all my people. Now, what do the scriptures tell us? Now, I love scripture, and pardon me if you're any other religion or you have any other belief. Isaac has told you I'm an Anglican priest. So really, the Bible, I really like. So allow me to quote you a scripture or two. The Bible says in Ecclesiastes chapter 10, verse 19, a feast is made for laughter. Wine makes life merry, and money is the answer for everything. It is scripture that money is what? Is the answer to everything. Now you're beginning to think, really, is that in the Bible? When you get back, go back, read that scripture and underline it, that money is the answer to everything. And that's what God is saying to us. But when I say that, I have to quickly quote another scripture. Timothy, 1 Timothy chapter 6, verse 10 says, for the love of money is the root of all kinds of evil. Some people eager for money have wandered from the faith and pierced themselves with many griefs. So friends, I want to say this, that money is not evil for you as a doctor, a nurse, a dentist. Money is not evil. It is the love of money. When we begin to make money our most important priority in life, and all the others are less than that, then it becomes a problem. But otherwise, we need money. In fact, if you as an intern doctor, wherever you go, even after internship, if you find that the salary you are paid is not enough and you are tempted to steal or to ask patients for money, you would rather resign and go and look for another job, but do things right. Now, what can I do as an intern doctor, after internship as a medical officer? What can I do about this thing called money? Number one, I want to encourage us, friends, to learn to save. And some of these things I say you've heard them many times, but I'm going to emphasize them. Learn to save. When I did my internship in 2003, I did my internship from upcountry. We were paid a salary of 650. 600 and what? And 50. And I, together with a friend of mine, Dr. Conrad in Tithe, some of you know him who are part of Uganda Christian Medical Fellowship. We got our little money, got soft loans, and bought land in our internship money. In fact, for me, when I was ending internship, I had no money on me. I was clearly not bankrupt, but I had no money on me. Because we got, and at that time, we bought 1 acre of land in Namagembe at 7 million, 2003. All our internship money went, because even after internship, we were still paying the debts for the money we got to buy that that acre. Now, friends, 3-4 years later, when we each got married to our spouses, we decided now we need to separate this land. Each one got half an acre. How much had I spent on this acre? I'd put in 3.5 million. But when you think about it, think about an intern getting 650. How much do you need to save to get that money? It was a pain. Saving is painful because you are denying yourself of certain goods or good things now for a better future. When Dr. Conrad and his family built on top of that hill, it was a beautiful land on a hill, built their home on top of that hill. The other half of that land, which belonged to me, I sold it off. I had put in 3.5 million, 2003. In about 4 years, I sold it at 22 million. I'm just giving you an example. I want to encourage us, friends, let's learn the culture of saving. Number 2, when you save your money and it's beginning to increase, invest it. Don't just put money in the bank and look at it. The bank is not going to give you any much interest on that money. When you have saved that little money, please invest it in something that will give you more money. And I want to say this even when I talk about investing. Invest it in something that you understand how it works. Don't just hear someone say, this business of chicken is working, and you don't even know it. You are busy with internship and you get your little money and put it in what? In chickens. You will lose your money. Invest your money in something that you do what? Understand. And as you begin to build your money, as you begin to save and it's increasing, you need to learn the difference between assets and liabilities, because you are going to begin to invest your money into things. Assets are things that potentially will give you more money. Liabilities are things that will potentially take away money from you. When we have just finished, we started earning money, there is such a big pull, a big push, to be like any other, to show the world that you have arrived. To buy a car, to, rent a nice house somewhere if you're not being housed by the hospital, or to buy good clothes and things like that. But invest, be careful how you invest your little money. Examples of assets could be land, could be investing in yourself, in your career. You could just say and say, I am going to work for 2 years, and after that I want to go back and upgrade. And therefore, because I'm not sure of a sponsorship, I'm going to start saving money for that program. That is investing in yourself. You can invest in a car. And I say that to people who are a little more senior. A car can be a liability, it can be an asset. At your level as an intern, I am almost sure, I'm not 100%, but I'm almost sure you don't need a car. I'm almost sure you don't need a what? A car. For transport means. A car, I am in private practice. I must need a car because a car is like my office, going from here to there and whatever. So it can be an asset, but be careful. A car can be a liability. Expensive cars, big houses, expensive clothes, perfumes, and all those things. At this moment, think carefully. You might not need them. I want to warn you, my friends, that when you start making money, there is a big temptation to invest. People will come to you with all these money-making schemes, promises of these businesses that Zikola Chiralu. Have you heard of that? Zikola, you invest 100,000 into 3 months, you have 400,000. Be careful about Ponzi schemes, pyramid schemes. And I tell you that from experience, my friends. I have invested money in some Ponzi schemes because they were enticing. There was one called Telex Free. I don't know, you may not have heard it, you may still have been younger. There have been a number of them. Oh, we put money. I lost. Hey. I invested little money in this thing, Telex Free. The money was very nice. I said it was coming very fast. I took a loan and I got a loan of 40 million and put it in. 3 weeks later, the business shut down. Imagine you have saved your money for internship, all of it, 3, 4, 5 million, and then you just put it in this get rich quick thing, and in a short time, the thing shuts down. I want you to warn you, my dear friends, avoid businesses, investments, ideas that promise you a very big, quick, an abnormal return. Number 2, avoid investing in businesses which you don't know how they run. They just promise you put in money, it will come back. How are you using it? Avoid get rich quick schemes. Okay, friends? Build your money slowly, slowly. Build your money slowly, slowly. Don't be so quick to buy the big things. You will get there. Like Dr. Sabrina has told us, one day you'll be making better money. One day you'll be earning bigger as maybe as a specialist, as a senior medical officer, as a consultant, and you will get some of the things that you desire. Then don't be quick to want to get them now. Sometimes you end up losing your money. And so what are some of the things that you can, I want to encourage you to invest in things that will improve on your passive income. Passive income, friends, is that income that comes to you whether you are working or not. Okay? Whether you are working or not, the money is coming, or potentially it is increasing in value. There are many examples. In my internship 2003, I invested very little money in treasury bills. I always read about business and money. Why? Remember my hatred? The other thing that was driving me, I hated what? Poverty. Let me tell you, a poor doctor is tempted many times. A poor what? Doctor. You can invest in government bonds, even at your age. You don't have to have much money. The lowest you need is 100,000 for treasury bills. And you put it in, instead of putting it in on a bank account, stays there for a long time, you put it in, 1 year later, it has some, maybe 10% interest on it. That is something. It may be little, but it's something better than just putting your money on your account. Nowadays, there are things called unity trust, where you put your money, give your money to these investors, UAP, Britam Insurance, and they invest it for you and they give you back an interest. There are life assurance policies. For some who have families, they'll tell you, give us this amount of money every month for these years, for your children's school fees or for you and things like that. After 10 years, they give you back your money with an interest. Some invest in rental property. You may not afford to invest in rental property now as an intern, but I am telling you information that will help you later in the future. Rental property, rental houses may not bring back too much profit, but I will tell you they are a sure way of getting some income. If anything happened to you and you have them, you can sit home and know that at the end of the month, something little is going to come back to me, whether I am working or not working. You can choose to invest in land. You know, the land is not, you don't see the money immediately, but when you invest in that land, over the years, it increases in value. When you want to sell it, maybe to go back to school, it will have increased in value. Okay? Now, the trick about the first three is that in order to make a good money from them, you have to do what we call compounding the interest. So the little interest you get every month or every year, you put it back so that it also gains interest. That's what we call compounding interest. Okay? Now, I want to conclude with this because our time is fast spent. And what are the 4 things? I'm going to mention 4 things very briefly that will attract favor and money to you. I am saying this from personal experience. I am not talking about what other people have written, just things that I think will help us as doctors, as intern doctors, nurses, and whatever profession. What are those 4 things that will attract favor and money to you? Number 1, purpose. Determine that you will work and be the best nurse, the best dentist, the best doctor that your employer has ever seen. Purpose. to be the best physician, I mean, nurse or dentist or whatever, that your patient has ever seen. In other words, when a patient comes to you, let them get the best experience they have ever received from any health worker. Make it so hard for your employer to do away with you. In other words, they should think, I cannot replace this. This person is so hardworking, they are knowledgeable and things like that. Make it so hard. And when you do this, my friend, you attract favor. And when you attract favor, it comes with money. And how do we do this? Number one, improve your knowledge. Do not stop learning. Do not stop learning. Number two, improve your skill. Improve your skill. Friends, it is not enough nowadays to just be a doctor. It's not enough to be a nurse. It's not enough to be, just a medical officer. Or it's not enough to be a dentist. You need to improve your skills. What makes you better than the other person? It's not just competing with them and bad-mouthing people. What makes you better is because your skill is better. You care for patients better. You love your work. You are polite to them. There are certain things that are going to put you a class apart. So that when a patient comes to you, they will go and talk to other people and say, if you want dental work, go and look for this person. That if you want a midwife to work on you very well and have a good experience, go and look for this person. And when you do that, friends, you will attract favor to yourself. And that favor comes with money. Because as your name goes around, as the person who does the right thing, the best thing, definitely when the patients come to you, they will bring the money. Point number two, very briefly, is tithe. And now some of you are saying, what about tithe? Yeah? I am not a Christian. Those are Christian things. Those are Bible things. What about tithe? Now, tithe is basically 10% of what you earn. But I want to bring it in this aspect that you need to realize that a part of what you have, you need to give back to God. You need to give back to your Creator. 10% of your time, 10% of your money, 10% of your strength, give back to your Creator. It could be in serving your community. To give 10% of your Creator. It is a godly principle that when you give to God's work, the Lord rewards you, the Lord protects your things. I want to encourage you. You know, and this I decided in 1999. I think I was in my second year of medical school. I purposed in my heart, I said, God, you say 10% of tithe and offerings and things like that in Malachi chapter 3. I decided and said, let me test this thing and see whether it works. I said, God, from now on, I'm going to give 20% of my money to your work. 20%, not 10%. And since 1999 to date, everything I earn, everything, whether it's an allowance, a travel thing, my salary, I give 20%. I have not lacked, and I'm not ashamed to say that, because God has provided. God has provided. I remember when I completed my M.Med here in Makerere, ENT, I wanted to do a fellowship. At that time in 2009, we did not have any fellows. We did not have people who would do endoscopic sinus surgery, operating on the nose and sinuses using computers. Now, I wanted to do that. And I applied in the University of British Columbia in Vancouver. And I needed scholarship for that. I went to the Ministry of Health, they had no money. And I got a position, but I had no scholarship. So I told my professor after a few months, I can't come. I have no money. And he said, let me see what I can do. And in about a month, he wrote to me and said, prepare and come. And later when I traveled there, I found out that my scholarship did not come from the government of Canada. It came from an individual who came as a patient to my professor and said, "You do good work. What can I do to help your work?" And he says, "Oh, I have a student in Africa who wants to come and train in this specialty, but has no money." And that person said, "I am paying for everything." Guys, you lose nothing by giving just a percentage of what you earn back to God. God protects you. God provides for you. Close to my closing, help the needy. I'm saying this is part of what will cause you to find favor and to find money. Do not say, "I don't have enough money." I tell you, when you look back in your village, in your community, there are people who have much less than what you have. You give money to the needy. Do you know what the scriptures say? Whoever, Proverbs 19:17, whoever is kind to the poor lends to the Lord, and he will reward them for what they have done. You want money, you want to do well, and the Bible is telling me that one of the ways of lending to the Lord is by giving to the needy. I want to encourage you, friends, as you start out to make money, apportion some of what you earn. Little, it doesn't have to be much, to the needy around you, the communities around you. And finally, I want to encourage you, friends, to learn the spirit of being volunteers. And you will ask, what about being volunteers? Haven't we been volunteers? I mean, sometimes you think, I mean, even by being an intern, you're like a volunteer, isn't it? You think, eh? But I want to encourage you that one of the things that's going to attract favor to you in life is to learn to do things when you're not asked to. Is to learn to do a little more than what is expected of you. When you do that, you begin to set yourself apart from the rest. When there's work to do and people are feeling like they're trying, you say, "I am here, I want to do it, what can I do?" When you're out of internship and people are looking for jobs, you can say, "Can to the director, I want to come and volunteer here. In the meantime, as I know, I'm looking for a job." When you do that, and I will tell you that is lacking a lot in our community. When you do that, you begin to attract favor to you. People begin to look at you as a special person. They know that you're a person who is motivated to work, and they will give you the jobs. And when the jobs come, the money will come. Learn to be a volunteer. Learn to do a little more than is required of you. When I came back from, after doing my fellowship, and I'm closing with this, after a few years, I resigned from Makerere. I was a lecturer here. I resigned and went into private practice. But at that time, I was the only one who had training in the surgery and skull-based surgery. So I told my department I would continue teaching as a volunteer, as I continue doing my work. So from 2012 up to date, I have been teaching for no salary, no transport in our department. But I tell you, there are it. Number one, in teaching here in Mulago, in Makerere, I have gotten experience. I have free experience because there are more patients here. As I'm teaching my students, I am learning, I'm improving my skill. I'll tell you, I have purpose to be one of the best ENT doctors you will meet. Yes, it's one of my goals. I am not perfect. My academic, what are they called? These transcripts are not the very best. I did what I could, but in terms of my work, yes. We had excellent students. Yes, and what? Finger, say, by the grace of God. Black hair, there is a saying, a proverb, black hair works for gray hair. Black hair works for what? For gray hair. Simply meaning that when you are still young, work hard, be diligent in all that you do. There will come a time when you're in your old age, when you don't have the strength to do what you used to do. And at that time, the work and investments that you put up will help you in your old age. Thank you, friends, for listening to me. God bless.
Thank you so much, Dr. Reverend Ricky. I told you that he has a lot to do, and it's just time that he's against us. I wish we had the entire day. But friends, be motivated. This is just the beginning. We plan, the Lord has spoken to us that this has to be a recurrent thing, not only once a year, and we're going to look at different levels. We're talking to interns today, we're talking to the next level and the next level. It's going to be really continuous as we learn a lot from each other. Yes, money matters. I'm telling you, many people hate poverty. I don't think I'll make somebody who likes poverty a bad thing. But as you do, remember I told you about seizing the opportunity, do your best. Things will fall in place. I remember I was a class leader doing my MBA, and some guy walks in and says, "Dr. Ssinabulya, when you're overwalking on the streets, just get these car keys and drive until you get your own car." Look at the guy, I said, "Are you okay?" I took the key for 4 years. I was enjoying a free ride. So diligence, you do your bit, people will come and feel it. And sometimes you can be sometimes you might be aware and say, you know what, people are progressing, me, I'm static. Be diligent. People will advocate for you. He has told you a patient advocated for his supply or his pain. Your next job, you might actually be close to your next job, but because you disgruntled, you close certain doors. So not overstretch yourself, but do what you can do. You never know, that initial step might be your next answer. Many people actually keep telling me, I've never applied for a job, but we are there to tell you, oh, can you come? Can you come and work? I told you about my internship experience. I was very busy. I was a highly paid intern. Because the credit people were paying me, internship they were paying me. And when I finished, I felt tired. And I said, let me take a break. But people couldn't allow me to take that break. They said, because now there's a job offer here. And this was an SHO who saw me. Actually, later on, I had to do some background check. How did I get this job? They told me after a year that, you know what, there is somebody who told us and recommended you for this job because of what it was a CV, not written, but certain words were spoken. So be diligent. And the Bible tells us, show me a man's skill. You know, as we volunteer, as we spend time on the wards, skill is being gained. Dr. Ricky has told you about volunteering in several aspects. Teaching medical students, you learn this. As an intern, actually teach those medical students. You're going to gain in several aspects. One, your skills are being sharpened, but also they are going to be of great help to you because they want to come where it's value. They don't want to just spend time on the work, but they want to come, okay, this intern teaches us. Then they will actually bleed for you, they will run to the labs for you, so you can actually create an environment that works best for you. You are learning, the support is coming your way, and also peer to peer, and get times when you can reflect on things. Don't die out there. Yeah, so I'm going to invite the next speaker. I know our time is fast spent, but we're going to truncate some things. Yeah, so our next speaker is Dr. Prosi. You can help me share those slides where they talk about the speakers. Yeah, as I introduce the next speaker. So Dr. Patrick Wambuzi, he spoke to us earlier today. He is a senior dental surgeon. He's actually the chair for the Uganda Christian Medical Fellowship. He has He has several qualifications and work experience. He is the head of department, the dental department at Naguru Hospital, consultant for several private hospitals. He's an entrepreneur. Those who have heard about Pasha Dental, he is the man, the brains behind that. He takes good care of my kids. I'm proud to say that confidently, not because he's my papa, but because he does a great job to me and my family. He ministers, serves the Lord in many ways. He is a pastor at Calvary Hope Church International, and is our current chair. He served in UCMF for several years. Right now, he's our leader, he's our voice, he leads the executive committee. So Patrick, please come and speak to us on how we can be of integrity as we serve during internship and beyond.
Thank you so much, Isaac. My vote of thanks to the previous speakers, Dr. Ricky, Dr. Sabrina, Dr. Enock, and everyone else that has spoken. I was requested to talk about integrity, walking in integrity, and more so, integrity in the medical profession. So what is integrity? We'll start with that. Integrity is the quality of being honest and having strong moral principles and making sure that you adhere to them in an uncompromising way. You do not compromise the values that you hold. And in the medical profession, we have what we call ethics that guide us. I'm sure all of us that should have been first year medical school. We discussed the principles of ethics as far as medicine is concerned. These are some of the principles that guide us throughout our practice. If I may remind us on some of them, there was what we call beneficence, doing good. There's what we call non-maleficence, do no harm. There's what we call autonomy, giving patients, the freedom to choose what they want. And this calls for us as health professionals, when we're presented with patients, we ought to give them all the available options and modes of treatment. Some people call it the menu. You give them what can be done, and you explain to them the advantages and disadvantages of everything, and they take a choice. Sometimes, some doctors are inclined into convincing patients to do certain procedures, not because they're the very best of options to the patients, but because the doctors gain some money. We should not be a breed of doctors that do that. There is a cheaper option that you can give to a patient, even if a much better option, but you avoid telling the patient that option because you want to you have a catch somewhere that benefits you. Let us give our patients everything, explain in details, and give them a chance to choose what they want. Also, there's what we call justice. Being fair to all the patients that you see. Do not withhold treatment or care from a patient just because they look shabby or they do not look presentable You might be motivated by the way they look and say, the other looks smart. If I take good care of that one, most likely he'll give me a tip at the end. That should not be the motivation factor as you practice medicine. We ought to be fair and give the very best of care to everybody that goes through our hands. And do not judge. Please do not judge patients. One day, I was awakened to a rude session with a patient. I worked as a dental surgeon in one of the best hospitals, high-end hospitals in Uganda. At that time, it was Kampala Hospital, as one of their very best dental surgeons. A patient walked in. She was a lady. She did not look that enticing in terms of the dress code. She was ordinarily dressed, and she had issues that costed a lot of money. But I just endeavored to tell her, in my mind, I had already judged her that this patient may not afford this kind of treatment, even though it is the best. But I told her anyway and explained everything. I expected her to say, okay, thank you so much, doctor, for the explanations. Let me go and work out my finances. Probably someday I'll book an appointment. I remember explaining everything. And at the end of the story, the patient told me, let us start the treatment, and paid all the bill at once. I said, Banang. Judging patients is not good. Let us not judge. As we see our clients, let's consider them equal as we walk in integrity in everything that we do. There are different types of integrity. There's what we call internal integrity. This is one whose integrity at the deepest level, deep down in your heart, and derives its strength from the character, the core values that you build over time. Some of us have been in homes, have been raised in homes where some of these values have been passed on to us. But on the other hand, there are people that were raised in homes where some of these values were just a by the way. And these contribute a lot to who we become in the future. And the principles that we hold dear to our hearts, the principles that guide us through life. If you were raised in a family that had some of those wonderful principles, please adhere to them, because they are very key as far as integrity is concerned. Your character, integrity being the foundation of character. But for those that were raised in families, that some of the things were just a by the way, you just bumped into them, please, you can aspire to become better in your ways and everything that you do. The other thing that guides and gives strength to the integrity that is internal is your belief. What do you believe? What is your faith? Who do you say is your God? And I remember sometimes when I'm teaching students, interns, and other students from different parts of the country in our group, everything I do, I tell them, first, I am accountable to God for whatever I am doing on this patient. Is God happy with what I have done? Say a procedure, maybe a surgery. Is God happy with what I have done? First, be accountable to your God. Then you can be accountable to your employer, be accountable to your patient, and be accountable to yourself. These shall help you live lives of integrity in everything that you do. The other types of integrity, we have what we call the external, is what is portrayed, those around you. Humans have a way of displaying themselves in different forms. You can be somebody else when you are alone. You can be somebody else when there are friends around. You can be somebody else when you're somewhere else. But integrity reflects similarities in all these. Both your internal integrity, aligning and speaking exactly the same thing as you portray when you're near your friends, and the imagery integrity as well. What the picture you give out there, should be in line, should be aligned to one another. Some of the attributes that I want to talk about, attributes of integrity that will guide us as we work and walk through life. One of them is being authentic, being genuine, be humble in everything you do, and be approachable. Do not put this shield around you and make everybody be afraid of approaching you. Don't make everybody be afraid of consulting you. It is not necessary. Value other people's time. When you make an appointment with someone, please endeavor to fulfill that appointment. Plan ahead of time. Life in a city is full of distractions. You can decide to say, I want to be there at 9, and you set off, let's say 10 minutes to 9. Somewhere along the way, you'll find jam, or you find an accident somewhere and the cars are stopped, and you'll definitely be late. It is important to plan ahead and say, okay, if I'm going to be here, let me set off a little bit earlier and make sure I keep my appointment. Please value patients' time, value colleagues' time, value time of everybody as you walk through life. Some people say time is money. Isn't that what they say? Let's value it because it is important to others. Give credit to others. If somebody does something good, encourage them to do even much better. There is scripture in the Bible. You've taken note that I am a pastor, so I will not apologize for quoting the Bible as well. There's a scripture that says, spur one another and to love and unto good works. So encourage one another and spur one another to do much better. Sometimes, especially when you're just beginning a career, you make mistakes. As interns, you'll make mistakes, but be humble enough to apologize and say, I am sorry, and work towards doing better. Admit and take responsibility of what you've done, and do better. I remember one of those moments when Naguru and supervising some of the interns, we instructed one of them to extract one particular tooth which was sick, and I don't know what happened. Somehow, the young man went for a normal tooth. And at the end of the story, the patient looked at the tooth and said, that's not the tooth I told you to extract. Yeah. you know, and it came to our attention because the patient was very bitter and complaining. And the one which was sick was a wisdom tooth, which normally we say, if it is sick, let it go. The normal one he took out was a very valuable one, the second last. And when the complaint came to me, I said, okay, I'll do whatever I can to save whatever has remained, you know, in exchange for what has been taken out, you know. But we had to apologize to the patient, acknowledge the mistake we had taken, and we took responsibility of whatever we did. You know, when you're a supervisor, whatever the intern does is your responsibility. Isn't that so? I know you're going to become supervisors, you're going to become lecturers along the way. In your career path, you're going to become directors of hospitals. You're going to become these big people, you know, in different offices. Your career is just beginning, but these are some of the things that will make you be set apart from the rest. Believe in others. You know, give them a chance to become better. Several times, as a supervisor in Naguru, I have had complaints of you know, how students were mistreated in school, how interns have been mistreated, you know, and when some of them are actually bitter with whatever has taken place, and some of them may capitalize on what has been done for them to do unto others. Please be different, forgive, and let go, and do better to the people that you'll supervise, the people that you'll mentor. Give them a chance to become better. Communicate honestly and be open. You know, let your words be consistent with your actions. It is important to build a reputation and legacy as opposed to quick gains. Sometimes you look at something and say, okay, how much am I gaining here? You know, and you choose to do the other way, yet there's a better way that can give you a long-lasting reputation and legacy. Choose to do things right. You know, work diligently. It's very, very important. Show me a man who is diligent in his ways, and I'll show you a man who will stand before kings. That's Proverbs 22, verse 1. Do your very best in everything you do. In our country, sometimes we are in a place where the available equipment, the available resources are not enough. But even in such situations, make sure you do your best and leave the rest to God. I'll give you an example. When I was an intern, there was this old judge, had some family members and granddaughters around that were taking care of her. She had a condition called necrotizing fasciitis, but also she was very, very anemic. My supervisor at that time instructed me that please go and find blood and come and transfuse after the ward round. At about midday, I took a notice to the laboratory. I said, I need this type of blood and I need to transfuse. I have a patient who urgently needs this blood. They told me the blood was not there and they were bringing some more. I kept checking from midday, 12 noon. It came to evening, the blood had not yet arrived. And I kept waiting. I waited up to 10, I went back there, I said 10 p.m. in the night. I said, has the blood arrived? They told me the blood is still on the way. And until midnight, that's when I received the news that, oh, the blood you want is not there in the blood bank. And I said, okay, I have done my best. I leave the rest to God. I waited and gave my best. Unfortunately, when I went back home, I came back early in the morning. I found my supervisors were busy trying to resuscitate the old judge, as she was passing on. And they said, what happened? We told you to get the blood. I told them, my friends, I waited for blood from midday up to midnight. And this is the report I got, that there's no blood for her. There's nothing I could do. Up to now, I still remember that moment, but I have freedom in my heart that I did my best in the circumstances that I had. Quickly, as I come to the close of my session, I demonstrate be of responsible behavior, follow the medical policies and ethics, convey truth and kindness, show regular reliability, challenge yourself, challenge yourself to do better in every situation. Do not compare yourself to me. Do not compare yourself, Dr. Ricky. Do not compare yourself, Dr. Isaac. They have lived through, they have gained experience, but aspire to become better. If you compare your chapter 1 to Dr. Isaac chapter 20, you will be so discouraged. You will feel very low and you may think that you cannot make it, but yet you're just beginning your career and your journey. Aspire to do better, give benefits to others, show respect to everyone. The importance of integrity is the core quality of success and living a happy life. It enhances all the other values, determines the quality of the person that you are. It is the foundation. Is the foundation of character, helps one be honest with themselves, and fosters a positive work culture. One attracts into their life the people and circumstances that they are in harmony with, their values and thoughts. Keep the good company, value integrity as much as you can, be true to yourself, be confident in everything that you do, honor your word, do what is right, be honest and transparent, and accept personal responsibility. I'll give you one more example. There are doctors that when they enter, a line of patients is behind them. Yet there's another doctor next door doing exactly the same service, and they have about 2-3 patients. What is the difference between this one and the other one? Reputation and legacy that goes ahead of you. So discover your inner life and define your sense of purpose. Now determine what you want to become now. If you want to be the best surgeon, determine it now and work at it. If you want to be the best physician, determine now, purpose, and work at it. Whatever you want to become, you can become when you become intentful about working on it. Define your values and define your future. And with that, allow me come to a conclusion. Have your life represent your inner life. Make clear decisions. Stay committed to what you believe. Stay open to becoming better. God bless you.
Thank you so much, Patrick, for this. Yes, friends, it's a packed menu, and I'm sure you are feeding well. Yes, it's packed. Yes, so integrity. Thank you so much for those words. Yeah, keeping the standard. Our next speaker is Mr. Aliga, who is is a professional nurse with vast experience in various management positions, including emergency critical care nursing. He's a senior faculty at the Aga Khan University School of Nursing. He's the executive member of the Emergency Care Society of Uganda, as well as the Critical Care Nursing Association, President of the Association of Nurses and Midwives in Uganda. And wow, what a huge CV. President, Africa Federation of Critical Care Nurses, and currently is a PhD fellow, yes, for UNISA. Mr. Aliga is online. He traveled, he was out of country, but he's been gracious to actually go ahead and share with us remotely. So, Mr. Ikwe, please share with us. The floor is yours. You can share your slides.
Yes, good afternoon, members online, and I send you greetings from upcountry, where I have been conducting a training for emergency and critical emergency care approaches in the country. And it's a big privilege for me to speak to you, though online, and I'm sure technology is quite available for us to do this. I hope everybody is hearing me. If anybody can confirm to me. Are you able to hear me?
Yes, we can hear you.
Okay, great. My network is certainly unstable. I will request that I may not use my video for the sake of saving the network, and therefore allow me to just just as I said, my network is unstable. I apologize for that. And I'm going to put my video for that matter. And just as I've been introduced, my name is Aliga. I work with Uganda University, and I am an emergency and critical care nurse, and that's my specialization area. And currently I'm taking a PhD from UNISA, University of South Africa. God willing, I'll be graduating this year. My focus on patient safety and the quality of care, particularly I'm interested in the adverse events reporting strategy in this country. By way of outline, I'm just going to outline a few things because our time given to me is only 15 minutes. I will talk about briefly key resources because my topic for today is managing hospital resources. And you might be wondering why this is given to me. And I'm sure all of us are aware that most of the resources in hospitals are mostly being managed by nurses in terms of using these resources, allocating these resources, accounting for them, maintaining them with a team of other health workers. Nurses hold a lot of responsibility in terms of resources, including human resources. Just because one of the reasons is majority of the human resources in every facility in the country or anywhere in the world are actually nurses.
Mr. Aliga, please share the slides. We're not able to see them. Trying to share the slides.
I will just go straight away. The benefit of probably I want to start with this. As medical interns, quite a lot of things that you will experience in your career as you're going for internship. And I just want to highlight that internship is quite beneficial. And I want to just highlight that do not miss to expand your clinical knowledge, especially when you go and start your internship. Develop your confidence and resourcefulness during this 1 year period of internship, and build your personal and professional network, because that's the best opportunity for you to build your professional and personal network and connecting with other people. And do not forget to sharpen your verbal and non-verbal communication skills during that time of internship, because you may not have that kind of opportunity probably in future again to really manage a variety of patients and in different wards, and make yourself become more relevant to your employees at that particular time. And I want to recognize all other comments given by other previous speakers at this moment. Now, the resources that we are managing health facility as nurses and as any other healthcare personnel are strongly linked to the different aspect of patient services that we provide. And these resources are broad. They are human resources, they are materials, their infrastructure, there are a lot of things that are in the hands of the managers who are going to be working these facilities, and these resources needs to be managed effectively. But I want to highlight that the concept of managing these resources is that what is behind the background is that these resources will be managed in a way that patients are safely taken care of, regardless of whatever resource it is. The ultimate goal is patient safety. And that's one of the things that I really want to emphasize, that any resource that is in your hand, make a consideration that patient safety remains the core of whatever resources you're going to manage. Now, just to make sure I don't forget about mentioning the key pillars of patient safety in terms of resources, is I want to highlight 5 key pillars that probably we need to put in our mind when I'm going to go through this. Is number one is that one of the key pillars of a patient safety is to have a clear safety policy in place. Besides the resources that you have, do we have a clear patient safety policy in place? Number two, put in place organizational strategy to support patient safety with the resources that you have. This could be in terms of allocating the resources, in terms of allocating the personnel where they are going to work, in terms of responding to crisis in a way where health services are going to be provided. And number three is have a safety plan in place. And this plan for safety of patient in terms of all resources should be shared with all the staffs. And every staff should be aware what safety plan do we have in terms of inadequate staff, in terms of inadequate sundries, in terms of everything should be shared. And besides that, remember that once you put safety as a core, continue to measure the performance of your safety strategies. Are they effectively working or something is missing? Finally, provide feedback to every department, every team member who is working together with you to provide strategies to improve safety in terms of resources that you're managing. Now, to achieve all this situation, the leaders who are going to be in place to make sure these resources are managed effectively, the leaders need to escalate daily a brief about safety issues in terms of resources that are handling, overviewing of the events that are happening the day, and identify risks that have been happening that day. And besides that, mitigate ward safety in terms of looking at all the personnel, looking at all the concerns that are happening in the ward, so that everybody is aware that these resources that you're managing, safety remains number one. Finally, identify hurdles, particularly which are hindering safety of patients, which are hindering service delivery in terms of all the resources. Both nurses, doctors, and patients should be taken care, should take care of these resources in a way that these resources address the service needs. Now, I want to highlight here some best practices in resource management, and there are about 5 of them. And I think that is where I will simply end my discussion for this study. Number one is that when you are managing resources,
Seem to have lost him. Oh, he's back. Mr. Aliga, we cannot hear you. I hope somebody that hasn't called in. Wow, we seem to have had some connectivity issues where he is. Yeah, we seem to have had some connectivity issues where he is. I think, in the interest of time, I see he has gone. Yeah, I apologize for that. He is completely off. Yes, I think we'll get his slides and we can share them. But at this juncture, I think we could move on. Still have some more presentations. So I beg for us to look to the next speaker, Dr. Imelda Namagembe. Is going to come and speak to us. Yes, thank you. So, Dr. Imelda Namagembe, she's a great teacher, has taught many of us, and still does. A senior consultant, maternal hospital medicine. She works at the specialized women's hospital. PhD fellow, she has research interests in use maternal death, neonatal death. Think about what in this regard. She had to speak to some of these things and how we respond to this government there. This happens in us for healthcare through mentorship, emergency response, and emergency response. She's mentored many of us. So Dr. Namagembe, if you have it there, speak to us as we take notes as well. Even some of us are going to be taking notes, not only the time. Thank you so much.
Morning to you all. I'm honored to be here, to be part of this with the Uganda Christian Medical Fellowship. Thank you so much for the efforts to really organize this. And to the dear interns, our sons, predominantly sons, you never know, there may be grandchildren there. You are all very welcome. Our issue, the discussion at hand, talking about thriving in the medical profession. I'll just briefly remove the mask. You never know, we may bypass each other. A lot has been said by the previous speakers. I would like to really thank them for that. And regarding the issues of laying the foundation, there is aspect of enhancing quality of healthcare, emergency response, and the emergency readiness. From what the speakers have already said, when you look at where we go when we are doing our internship, you realize that we tend to work mainly in the health institutions, in the private sector, in the teaching institutions, in a number of places. But when we look at most of the mission and the vision for most of those institutions, there's something about excellence. Maybe excellency in provision of healthcare, excellency in the teaching, innovative ways so that we can improve on the quality lives, excellency at our various private facilities where we work. And all this, we realize that the aspect of quality of healthcare is embedded in there. And we've noted that we've lost a number of lives quite often. Of course, we've saved many, but there are times when we've lost a number of lives, when you realize that there have been certain issues, especially regarding emergency response and emergency readiness. So when we talk about the medical intern, what's the role of the medical intern in enhancing quality of care? And why about the quality of care? This medical intern, most of you will bear with me. I remember we used to be told when we were still young like you, and we were told that when you find a very keen intern, if you find that intern so resilient and informed and can really communicate to bridge that gap, can really apply what that intern learned in the medical school, to take a proper history, a quick one, because at times emergency, you don't need to take all that details like what we used to write in our class sheet. But taking a quick history, important history, quickly going through and doing the examination, more than 70% of the cases, you are almost. But currently, a number of things are happening. Say that some of us have forgotten the importance of the history taking, they've forgotten the importance of a proper examination. At times, the woman may present to you so weak and dizzy, and always said for a low abdominal pain for ultrasound scan. And the next thing you realize, someone is collapsing as they are taking that person the ultrasound scan. And yet that's very great intern. If you took a quick history examination and quickly consulting, we may identify maybe a ruptured ectopic or some other condition in surgery or medicine, which requires a quick intervention before they even go further ahead. So, a role of the medical intern regarding the quality of care, we are saying issues have to happen in a timely manner. And when we talk about the term of quality of care, and these issues of emergency response, and the emergency response, and appreciating that no one can do it alone, we need always to be part of the what? Of the team. When we talk about quality, we need to be reminded that there's performance according to the expected standard. And then there are certain requirements and specifications. And remembering that we need to do the right thing, the right way, and at the right time. So as they take us through the medical training, and that period of internship is basically to ground us. How do we translate that theory and be able to pick on the key skills so that we can be safe, people can provide a safe service within, of course, maintaining the consultation to ensure that we do the right thing. You've heard of many stories that have happened at times at the time of internship. I don't know whether you've heard of the stories where at times some of us have ended up cutting off the hand from a live child because of a number of challenges that we go through. Of course, as we talk to the interns, we also need to talk to ourselves as supervisors. But the issues of quality and reminding ourselves doing the right thing, the right way, and at the right time. Why they are taking us through internship is because the issues of doing the right thing, we are not yet thorough. We are trying to put the theory together with the guidance of the various mentors to ensure that we can be able to do the right thing. But are we doing it the right way and at the right time? How often have they called us at the various levels, interns level, in the next level, and quite often we fail to respond. At times we communicate in a harsh way. When the midwife or the nurse calls, and then we feel so proud, at times we lean on our phones, but the number of us who are doing a very good job. Thank you so much. Those who are doing their best and doing a good job. But even others who have been doing it the other way around, there's a chance to change and do it in the right time, in the right way, and be able to do what? Consult appropriately. Whenever we are talking about quality of care, there's a focus. We need to be reminded that we need to focus on the client. Remember the kind of clients we get. These clients may be educated. The previous speakers have already alluded to that. But at times they may come in when they are not educated. A number of our mothers may not be educated. It may be likely that most of the parents now are educated, but they may not have been educated up to a level. Because if you consider the population, probably still at about less than 10% who have a degree. So how do we communicate to all these people, irrespective, in a respective way, irrespective of their educational status, irrespective of their finances? One of the speakers was talking of the aspect of how we need to respect people, not to judge by their looks, because at times they may have all that is required. They may be the poorest, or they may be the rich of the richest. So focusing on the client and communicating properly is very critical. And this one has to start right from medical school. Start right from our homes. If you miss it at home, then as you go through the training, if you again miss it in medical school, then you need to embrace it again during internship. Because As we do the internship, remember most cases in public or private hospitals, but later on it may be in your private facility. Dr. Biarang has just told us something and reminded us that all of us need money, all of us need to thrive, but communication is very important and focusing on the client. Then the issue of systems and processes. Of course, we are working in environments which are challenging, but what is it that we are doing despite the challenges in those environments? There are times when the supplies are there, a number of environments have erratic supplies, but there are those moments when we can be able to do something, when we are able, when we have everything in place, but what is our role? What is it that we play? And then the issue, right from internship, we need to appreciate the importance of data. That is information that we document. That information can be put together, and later on it can inform. It can inform the practice. It can inform us to do certain things differently. Therefore, right from medical school, internship, and even as we move on, we need to appreciate the aspect of documentation. Communication, documentation, and consultation are very important. Utilizing the data that we collect from in our facilities is very important. And if we don't document properly, then it will be hard for us to utilize the data. So as an intern, you are a critical group. Then the issue of teamwork and collaboration. I don't need to overemphasize that because it has been already alluded to. They've reminded us that none of us can do it alone. We need to work as teams. So in the kind of work that I'm doing, I've already told you that I'm putting over on a part of a student. It depends on when an opportunity comes on. Even at this stage, when I've taught a number of people, you realize that an opportunity can come on when you can do something. Like now, I'm doing research in the maternal health, looking at issues of maternal death surveillance and response. But the issue of teams, it may be that you need to talk to your colleagues, the specialists, what is it that we are doing, what is it that you can do differently. You need to discuss with the various people, like the middle picture there. It had interns, it had medical officers, it had specialists, it had midwives, basically teams, all of us playing different roles regarding what we are supposed to do. You may need to talk to the people we serve, like in this case, I'm in obstetrics, talking to the pregnant women, informing them about ABC, then even you, the intern, as you do the service delivery, maintaining that you talk to people, informing them about what we are seeing in other circumstances is very important so that we aim at improving. Even embracing other members in the society, like the Rotary Club, talking to all those people is very important. There's a way it is going to build us and trying to see how they can contribute to communication with the communities, the issues of timely referral, all these can make a contribution to quality of healthcare. And then we need to be reminded, this one I've already talked about it, that taking a proper history still has a role in the proper patient management. Performing a proper physical examination is still very important and critical, and embracing the issues of the investigations, timely communication, consultation, and of course documentation. Just briefly, it will be hard to talk about this without reminding you that in our country, especially in obstetrics and gynecology, we are still seeing a major burden where we are losing mothers and newborns. And we still have a high burden of mortality and even newborns dying. You know, pregnant women, and when they are moving around, it's like a natural process. But to realize that in our country, we still lose women from preventable conditions. And partly because our teams, especially where there is lack of that resilient bridge of the timely communication, like for example, when the midwife sees, when the intern calls, can something be done? Can we respond in a timely manner? We realize that if these things are not done in a timely manner, at times we lose a number of people. But in the event that we've lost someone, I would just like to request you and to encourage you to embrace the aspect of what we call maternal death review as a quality improvement process, the perinatal death review as a quality improvement process, even in the various disciplines. It can be in the heart institute, it can be in medicine, it can be in surgery. Embracing the review or the audit over death is important in that it can help us get a story from those who have passed on. And as an intern, if you really embrace it from that level, There are times when we learn stories from those deaths, and then we use them for quality improvement in order to prevent preventable mortalities. Again, as an intern, you are a great resilient bridge, a great factor that can make a difference regarding these indices. I just want to mention that, of course, you cannot do it alone. As the supervisors, we need to be available for the interns. And even this talk, as we organize it as the Uganda Christian Medical Fellowship, this is not the end. We even need to talk to ourselves as the seniors and say, what is it that we need to do differently? So, just to remind you, in the maternal prenatal day surveillance response cycle, to be unfair not to talk about it when I've told you that I'm a student, and to remind you also, and yet you are also a critical gateway regarding quality of care. In the event that this one is not safe, it's important to identify that death and notify it. We are supposed to notify within 24 hours. Who notifies? Even the intern can notify, but in collaboration with the doctor or senior officer in case you have one, or it can be at another facility where there are no senior officers, and inform the person who was on duty, with the purpose that that death should be reviewed within the next 7 days to understand what are the contextual issues surrounding that death, so that finally we try to say, maybe if this had been done in a timely manner, probably we could have prevented that death, and then the cycle, as long as those recommendations are implemented. Just to encourage you that although what we are dealing with is like a tip of the iceberg, but we are saying that with appropriate skills, despite the challenges in our systems, those moments when we apply the appropriate skills, those moments when we do those things in a timely manner, those moments when we can communicate properly and do the things in a timely manner, as we continue to lobby, we believe we can do a lot more in our country, because many doctors who have trained in Uganda have really excelled in various places, which means that if we can do our part properly where we are, a lot can still happen as we continue to lobby to ensure that we improve. So quality care, remind ourselves the timeliness, the issue of doing the right thing and doing it at the right time, because there's no cost that we can tag to our life, and thus we need to minimize mistakes through the timely communication, timely consultation, and timely response, and of course, discussing with the people who are around, with the leadership, and trying to see how can we ensure that our facilities, the readiness is improved, so that we can continuously improve the quality of healthcare and save our people as much as possible. So as interns, you're welcome to this noble profession, but when we are being modeled through this profession, a lot can happen. We still have a lot of potential. Let's continue to do the best despite the challenges. And Uganda Christian Medical Fellowship is one of the places you can embrace. You need the role models. There's so many, most of the speakers here, Dr. Sabrina there in pediatrics, Dr. Ssinabulya here. You can call on them anytime, discuss something where you're having a challenge, because a problem shared is partly solved. We are not supposed to be poor, but at the same time, let's ensure that we are not so tempted by the 50,000 shillings from this patient, by the 20,000 shillings from this patient. It can distort your efforts that you fought for over the years in a matter of a blink of an eye. But together, we can continue to make a difference. Thank you so much for creating time. I thank you, everyone.
Thank you so much. Thank you so much, Dr. Imelda. I told you she has, yes, thank you so much. I'm always delighted when I get these words of wisdom, emergency response, and she's very patient-centric. And I think every doctor needs to have that. The reason why we did medicine or we do nursing, pharmacy, to have these people at the center of like, to be at the center, because they're the reasons why we are called nurse, the pharmacist, the doctor, and responding to emergency, the audits. You know, many times things happen and we just let it pass, but are willing to learn from that has happened. When Dr. Mira was speaking, actually, I remember, you know, they started calling me a doctor at age 9. And at some point, I wanted to peer pressure, go to engineering, what? But I remembered everybody has been calling me doctor since age 9. Now at 18, I want to change. But then when I joined medical school, internal medicine took the piece. And many times, you know, as we narrow down, we tend to shed off the others. Yet it's a complete package and everything fits together. So a few years ago, we were on the world round, anemia. A young lady presents with anemia. And we are here busy, we're thinking of transfusion, thinking of spiritual people, type that anemia. But she has mentioned something very key, take the history. Even as a cardiologist, I'm challenged actually daily. With the technology that's at play, we rush to do that echo, that ECG. And then it's normal, and the patient looks at you with frustration. And then it's because the history was not taken. Maybe it's the wrong test. They didn't even need it. So back to that lady, young lady with anemia. It's the ANMP that saved the day. And we're able to save the ruptured ectopic. Took the patient and you were able to sort. But just imagine, you plan to transfuse, you can actually lose the life. So as you focus to see these patients, take that history. We encourage from medical school that 80% of the time, that's where the answers lie. So, and as you take the history, actually building rapport. And some of these things, they might not have the confidence to share openly. But as you listen to them, they will tell you, and the answer lies in there as you draft your plan. So patient at the center and making sure we save that life. Yeah, so our next speaker is Gabriel, who is going to talk to us. Gabriel is a surgeon, very passionate. He worked up country for many years. And so he's a general surgeon with interest in laparoscopic endoscopic surgery. He undertook his undergraduate and postgraduate here at Makerere, but he has done additional trainings to find his skill. He's a skilled surgeon. Some of you have encountered him actually found that. He's currently a resident surgeon at the Casero Hospital, and I like his patient-centeredness. Because I tell you, Dr. Ssinabulya, I have this patient with surgery, and this is what I would like you to do. And work out something that's actually favorable for the patient. May we be motivated to do those kind of things to help and assist our patients in many ways. He worked in KCC Hospital for 11 years, so that rich community experience. We want to learn and be encouraged. After internship, if I want to go somewhere, those places, how did you survive those places? So please come and talk to us as we learn some lessons from you. Welcome.
Thank you, Dr. Isaac. This is morning. Good morning, everyone. I'll ask to remove my mask because I really look forward to the time when we shall leave these things. Yeah, I'm really tired of masks. Done N95, I've done surgical masks, now I've gone back to clothes, now I've done what? But I don't know. I believe by the time this year ends, so my name is Gabriel Okumu. I rarely use titles. If you find my notes where I write, just find Okumu only. Because I think life is all about titles, isn't it? When that day comes and they say who's internet, they won't say, doctors, yeah. Justice, yeah. Justice is here. Just be working. So I believe in, I'm just going to So I'm going to be talking something briefly about the topic I just to share about is asking yourself, where do you want to work? Do you want to work in urban? Do you want to work in rural? Do you want to work in private? Or do you want to work in public? I was surprised when I discovered that according to the definition of Ministry of Health, Uganda Hospital is considered rural. I think even Lagos Hospital is considered rural. So I think according to Ministry of Health, urban I think is raised in Mulago, maybe Kampala and Nakasero, but some are considered rural also. And that's why they can get allowances. And in fact, the ministry sometimes can even post people there as people want to have card, whatever that's up to you. So my topic is mainly ask us questions. Question number one, why are you where you are? Why are you a medical intern? Why are you Basically, why did you choose medicine? Like Dr. Isaac tells us when we went there because it was cold. So, me growing up, my dad kept telling us that we are mathematicians at home. So, all of us were supposed to do math. But when I was in this way, that's what I say, my best teacher told me that probably says Matomi. Those went to Namagembe, no her. She wanted to tell me that. She just came to class and said, she read a list of books she thinks she took that. And I was number one of this class. So you see, I told her about this. Now she said I should because they did a manual test, and I think 2 times I was the best with 52, you can imagine. 52%. No, I was but it was a hard test. So best person I went to it was a night, but then I ended up I liked it from class, I liked it from the prayers, I liked it from technology, what that, like medicine anyway. So the question is why you are? Either because the 3 doctors are rich, or either because you want to serve. I think that helps us choose where you want to go. I'll just share my story. After medical school here, because I grew up in police station. So I've been in Kampala all my life. I was like, actually, the very first time I lived outside Kampala was when I used to do those, I just still put rotations in Kasangati. We used to go to Kasangati for, I think, a term, first of the term system, 70 days term. And that was like, it was a quality. So if let's go to internship, let's say I want to internship, so let me experience also for the first time on my own road. But of course, I've been in America, which is also in Kampala. So I went to Ginger for internship. And my experience there was when I discovered that, hey, so you can live a full good life also in Kampala. I didn't know that. And it was good for me. Then when I was finishing internship, I remember the medical superintendent at that time called some of us and told us he wants us to stay in the hospital. That made me one that things were in our country, also one in the public hospital. Now, for my own thing, I'm really asking myself, what do I want to do? I want to go public or to go private? But frankly speaking, I just felt I don't understand the hospital. I think I've done medicine really well. I enjoyed my experience in Ginger, but at the end of it all, I didn't like the way it was one there. That's something I don't know if they're right now. Because most of the MOs were never there. They used to come for their silence only. I remember when I was my first day in internship, the doctor's pastor was there in the comments. But she said, I did my class, she said, okay, then you can talk about I don't trust this. This is exactly it. Next time I saw her was the 29th. So this problem is that it's a very important to see how I am. What's that the specialist? She was a medical officer, there's a specialist. She used to come once a week or twice a week. So I discovered that was what I wanted to work. So that's why when I finished it, I said, something I want to do. So that's the whole issue where I want to go. I think we're here and I strongly believe everybody who is a renaissance can post for me IT. So I can post for me a bus. Yeah, okay. So there's a verse in the Bible, Acts chapter 17, verse 26. And I don't apologize for verses. If you feel bad, it is your problem. So the Bible says, God made each of us from Adam and Eve and designed his specific places and what? And time when we should be. Most of us are saying, I wish I lived in the 70s. I wish I lived in the 90s. I wish I lived in the but good blood is important. What I was praying about is that God is selling houses. God is selling houses. God is selling houses. I'm not for people to also. I didn't feel that I wish I was a good blood is important. So good blood is important. So God chooses where it's supposed to be. I was saying so, Acts 17:26. So he chose particular times for everybody where to live and where to work. So I believe first and foremost, everybody in the park, or where they want to work private, urban, I first and foremost, we are all vessels, made by the master God. First and foremost, he says where you're supposed to go. Because another verse I'm talking about is Jeremiah chapter 1, verse 5. God told Jeremiah, before I formed you in the womb, I knew you. So I believe all of us who are Christians, follow Christ, before I think what is supposed to be, what is supposed to be. So your purpose is just that. So what I did is when I was in third year, one of my friends in the fellowship, we used to have fellowship. We used to meet in somewhere there. But when they told me that he's a friend of the second, then that time I just started the protection. I heard I should be a Christian. After that, my second was Muslims. I said, no, this is where I want to. I really liked it. I said, now I'm going to be a Christian. After that, it was medicine. I said, no, I don't need to see from my own. So after that, I went to internal medicine, and I like those things of syndromes about that one. Actually, up to now, my best syndrome in medicine is what? It's called, Dr. Namagembe knows, it's called Bakeera-Kitaka syndrome. The day I made that diagnosis when I was working this season, I took out my fountain pen, I with the fountain pen, and wrote with I left the beak in the pocket down here, and put the fountain and wrote Bakeera-Kitaka syndrome. And what I like is that all the nurses said, Doctor, what is this? I said, that is a condition. It's also called Hasherman syndrome. So basically, I used to enjoy those things. I was like, I didn't have to do medicine. But here, someone tells me in a dream, he dreamed I was a surgeon. So I was supposed to do surgery. I said, okay, fine. Along the way, I discovered that, anyway, I like surgery more, I think. But the trouble is, there was so much in surgery. You couldn't read the surgery books. I liked obstetrics because of one thing. It is the only thing that 10 teachers book. We hammered it in third year, hammered it in fifth year, all of it. There's no book you can hammer in surgery and say, I finished Fatel and love. You can't. But 10 teachers, she's not here. We hammered it in third year. But you can't hammer bail and love. You can't hammer showers. You cannot. But obstetrics were like, this one is okay, do it. Even Pete, you can't finish those books of Pete. You can't finish the books of medicine. I tried that book of Davidson, but you can't finish it. It was so hard, it was so big. But for obstetrics, they're like, let me do it. Because they can't have these teachers. You can't go as for 1 week and you. But go through it to surgery. So I went to surgery because of that trip. And along the way, what I liked about my career, after finishing Ginger, like I told you the story, I chose to go to Kisisi Hospital. Why? Because I just felt I didn't want to work in Ginger. I didn't like the place it was. I don't know how it is right now, those who work there, those who are good to go there, but it was really tough those days. You have to be very strong. Many times you have to take out your pocket to help patients. You're going to do a Caesar, they give you 1 stitch. You go to a Caesar. I remember one of my friends one time was going to do a Caesar. The patient came bleeding. She had ruptured the uterus, and he asked the nurse, if they would please give us a stitch. The nurse said, let the patient bring money. This friend of ours, my colleague, had to deposit his identity card with the nurse he works with for the nurse to give a stitch to work on a patient, and the patient lived. That's how it was. So I was like, I can't live in this, I can't work in this. So I chose to go to Kisisi Hospital, where I spent 7 years as a medical officer, then came for master's year, 2006, 2009, then went back for as a surgeon. That's how I got myself there. So the question is, where are you supposed to be? I still go back to the same answer. And so my belief is that God chooses where we're supposed to be and what we're supposed to be doing at particular times. So it is upon us, God, where we're supposed to be and what we're supposed to be doing. It is not for you to make up. But there's a verse I want to quote for us in the Bible. 2 Timothy chapter 2, verse 21. Let's see here, I think I wrote it somewhere. 2 Timothy 2:21. I got the first one. Okay. It says, those who cleanse themselves from the latter will be instruments for special purposes, made holy, useful to the master, and prepared to do any good work. So I think sometimes when you cleanse yourself, when you prepare yourself, when you make yourself what you're supposed to be, God can even uplift you and give you a better purpose. Because that verse comes from a verse that tells us that in a house, there are vessels, just like at home. When growing up at home, we had plastic cups, we had cups of metal, we had cups of melamine. And plastic cups were for daily use. When visitors came, they used to bring out the melamine plates and melamine cups because God chooses like that. So basically, even you as a Christian doctor, a Christian nurse, a Christian pharmacist, a Christian dental surgeon, God can make you even better from what you do. So as I come to close, I want to share with us, how do I find myself where I am, for example? After working in Kisisi, I was very comfortable in Kisisi Hospital. I was getting much satisfaction there. And the biggest satisfaction in some of those hospitals is like, you have your lists, you work on your patients. And like when I came here, Dr. Gakwaya used to laugh at us that now you come here and you're nobody. Dr. Gakwaya, one of our seniors. But where you've been, and it's true, when I was in Okunjiri, for a long time, I was the only surgeon in southwestern Uganda. So truth is, when Museveni was coming to Okunjiri, I was invited. I used to sit in front there also. Basically, you're a big person up country. When you come to Kampala here, just disappear in the crowd. So things you have to get used to. That's how it is. But what do you want in life? What are you looking for in medicine? Me as comfortable in Kisizi. Then at one time, actually, when I came to Kampala, by the way, I'll tell you the story as I finish. One of our sons tells us one time that he's tired of studying up country, wants to come to Kampala. I told him, okay, fine, I'll go to Kampala to do an interview. I even chose bring you. If you pass, we bring you. If you fail, we go back. He says, fine. The guy shocked as he comes and he passes. And I was in P4, I said, now you go to stay. So I had to get one of our aunties, his aunties to stay with him for some time. The following year, my wife tells me, my other 2 kids have to go to Kampala also. I'm going to stay up country. But time was coming. You can see hospital as a falls. I used to face those falls every night and pray to God, direct our footsteps. Where are we supposed to go next? Like I'm telling us, the Bible says another verse I want to quote is Galatians 5, verse 25. It encourages us to keep in step with the Holy Spirit. God guides you. Keep in step. The Holy Spirit goes right, go right, goes left, goes left, move backward, move backward. So I strongly believe like how I came to Kampala and Nakasero Hospital, I didn't have plan. After working in cases for around 2-3 years, one of my friends called me, I wanted a surgeon in case hospital. He told me, come, and you can't stay there. I said, man, I can't come. This guy told me, man, you're the most stupid person I've ever seen. You got a chance to come and work in Kampala and staying up country. Like, yes, I'm comfortable here. Okay. It's like, that's the trouble. Of course, up country, like I told you, food is cheap. You don't have to drive. There's no traffic jam. When the president comes to visit, you're also among the people on the guest list. You put on your suit, you go and greet also the president. You're a big man, basically. Everybody knows you. As a surgeon in Southwest, so all RDCs knew me. When they were sick, they would call me first. This time, the American embassy had a patient who was sick, I think going to Rwanda. And they had to call us to get attend to the patient on Kampala Road because when you come to Kampala, let's disappear in the crowd. But it's part of life, you know, so you choose. So after some time, we're coming to Kampala with the kids. And I buy, it was a Tuesday, I remember very well. And I buy, as in Baratown, I can't buy a newspaper of Monday. It's like, okay, that was after some time, after that story of the case had ended. I see this newspaper, Nakasero Hospital wants a surgeon. I said, now what do I do? Now my son, Riot is now in Kampala. My wife told me she's tired of the village, she doesn't want to come to Kampala. Now I was alone that side by that time. I was staying alone in Kisi, working alone, my family was in Kampala. Now that thing of moving all the time, doing what was becoming a hassle. I get the newspaper, I see an advert for a surgeon in Nakasero Hospital. I said, oh, okay, let me apply. But that advert was for yesterday. I took in my papers. My goodness. When I went and heard about the shortlist, people were very many. Amongst those was one of my very close friends. We agreed that, man, we can't do the same interview together. And sometimes you can have a friend and say that we can't do the same interview. It's not fair. How? What if you beat? So we agreed that if both of us get shortlisted, one has to pull out. If none of us gets, we should not. But just assuming it was God's will, I got shortlisted. He wasn't. Went for interviews. Several levels of interviews. Now, anybody who knows about the secrets, the surgical job in Nakasero was a bit very ring-fenced. It was very guarded. It was hard to get a surgeon there. All surgeons that go to Nakasero Hospital had failed completely to work there because of some reasons we won't discuss here. But they're not lasted. You can't last a month, can't last a what? I go to God. Interview level 1, I know I passed. I go for level 2. It was not easy. After that interview, by the way, I always got the prayer mountain. After level 2 interview, I went to the prayer mountain that night. I was like, God, what is going to happen? Am I getting the job or not the job? I was still having mixed feelings. Change cases come to Kampala. Me, I was like, whatever God does, I will do. After that, I just stayed there, waited 1 month, 2 months. They called me that now we're going to need a job. I came and told them, fine, thank you for giving me the job, but I was a deputy medical director and I said, I can't just leave, so I want to 3 months. I said, fine. Imagine you being given a job in Nakasero, there's no surgeon, and they give you 3 months to go and chill, and then come back. What is yours stays yours, no one takes it. That's why you have to be in step with the Holy Spirit, and you have to know what God plans for you. And that's why I came to find myself in Nakasero. And everybody got surprised. No surgeon had lasted there before, but I came. Of course, the forces that were fighting people, there are forces in departments in some hospitals, Dr. Isaac knows, even their department was had at one time in Nakasero medicine. But the fact that you stay there, and God protects you and God keeps you, that's how I managed to stay there. And I enjoy what I do, I enjoy my work. And I can tell you, if you stay in God's will, God protects and God guides you. That's why I can tell you comfortably. This is the secret. If they call a meeting for 4 people to go and meet and have some discussion, since I'm a Christian and I don't tell lies, I don't go for that meeting. Even none of rich people, I may not go also because I also think I'm a Christian, I also don't lie. I don't know what rich people is. But for the poor, I want to go. So I'm okay, basically, because I'm still in God's will. Because the last verse I'm going to quote as I finish, the Bible tells us, Ecclesiastes chapter 12, verse 13. After all has been said and done, the whole duty of man is to fear God and obey his commands. That's what matters most. It's not about how much money you had, but about how much what you had. When I hear in a medical school, I learned something. One of our friends, his dad was a consultant, one of our medical school students. And the dad died. That time there was an epidemic of cholera. And people were so many, so the mortuaries were full. One morning we come to study, and then tell us that our friend's dad has died. We go to the mortuary, and this man, who was a very big man in Lagos Hospital, was on the floor because all the fridges were full. That day I learned one lesson, that on this earth, nothing really counts. Whether they drive a Mercedes Benz, whether they drive a BMW, whether they drive a Maybach, whether they drive a what, it doesn't matter. When the time has come to go, they put in one case and then you go. That's why I read the verse again. Ecclesiastes chapter 12, verse 13. After all has been said and done, the whole duty of man is to fear God and obey his commands. When you do that, I can promise you, God takes care of you. They have talked so much about here, things about money, what. And another thing to ask yourself, what do you want? Are you looking for money? Some people want money, they want private, they want money. But sometimes you can do private, there's no money. And I have a friend who does not believe in private practice at all. He's very comfortable working for government. That's what he derives satisfaction from. I think the most important thing for a doctor, like we've been sharing here, sorry, I missed the first speaker, is to serve. If you serve and you serve well, especially wholeheartedly. Another verse I want to read says what? Ecclesiastes chapter 8, verse, I think chapter 9, verse 10, or 10, verse 9, says, whatever your hand gets to do, do with all your might. Because in the grave where they're going, there's no work, you can't work. So when you get work to do as a return, you work. I think one thing I can say comfortably, where everywhere I've gone, whether it is or what, and let me tell you, when you go to work somewhere in town, like me, I'm not lying, I'm giving a testimony. When I was in Ginger, the MS called some of us, were very few, and told us, could you please stay and work with me? We said, no, you can't stay. I went. When I was in Kisses, when I was resigning, Kisses is what, church hospital, even the bishop himself called me to his office and said, man, what do we do? Can you increase man and his chair? I said, never say, my time has come to go, I'm going. Even Nakasero, if I decide to resign now, the board chairman will call me. God bless you.
Thank you so much, Dr. Okumu. So, you know, he mentioned something, your lot is secure. It's also in the Bible. Psalm 16. I love this psalm. Please take time and read it. Psalm 16. Verse 2. I said to the Lord, you are my Lord. I have no good besides or beyond you. You know what's your treasure? As we serve this, because many of us are it's a calling. Why we enjoy medicine? It's because there are things that can. What's your motivation? It's a service, and it's that service that actually causes us to shine, even when the energy seems to be drained. Somehow you get energized because you're on mission, right? Yeah, and then verse 5 it says, "The Lord is my chosen and assigned portion, my cup. You hold and maintain my Lord. The lines have fallen for me in pleasant places. Yes, I have a good heritage. It's a good thing to know that you are serving God. He cares for your back, right? People will come and they will, foreigners will build walls for you, right? People will come and stand for you, but you need to do your part. It's not, you're going to be praying and not acting. Somewhere in the scripture, there was a time when there was a war. There was a sword in one hand, and they were working, building the wall, right? So even as we do medicine, even as we serve, be plugged to your God, because that's where your strength comes from. But he instructs you, you know, God speaks, and as he instructs, deliver and do. Because as you work, people are watching, being excellent. Dr. Sabrina shared some things. You know, if you lay back and you don't do, then you're closing off certain responsibilities and certain options that are for you. People will plead to have you, and then you will wonder, but why me? Other people actually, it won't be you saying why me, because it's too good, right? You don't even have time to think why me, but others will say, but why are they sticking to this young man, Ssinabulya? Above all things, why is it him, right? But it's because you've decided to be diligent and you know your reward is secure. So many times, because we don't have that assurance that things actually, the lot is secure, we tend to go into bad competition, play politics, right? You want to play politics. Somebody has clapped and then you want to come and you to take the credit. You know, we are in a phase where supervisors are going to be present, right? It's multi-level, where the politics can't save you, right? But be diligent, do your part. And as you're doing, people are supporting you. You will have it easy that you know you've done internship, there is no time even to rest. People are calling, you have like 5 offers. Then you have to go to God and ask, okay, out of the 5, where do you want me to go? Out together. So let's be diligent and let's purpose to allow God work through us. I'm a heart doctor. I'm so passionate about people's hearts, and I'm learning a lot from patients. I lead a patient advocacy group, and these patients have taught me a lot of heart medicine. Listening to these patients, because many times, you know, those who do research, there's a concept of self-care and self-care and management. Many times the theory, we have too much theory, but the practicability of it is when you listen to these patients. They can actually make your life easy and they give you feedback, but it's humbling yourself and sit with them. They put me in one of their WhatsApp groups, but it's amazing. I'm learning a lot, but they freely tell me things, and you've been able to avert death because things have been reported in real time and help these patients. So as we walk through this journey, we want a career where to go. He has told you, deciding rural vis-a-vis public, academia vis-a-vis public health service, research vis-a-vis policy. They are leaders among the stars. But when you have that inertia within you, the fear to step out, your skill might not show. You know, we are the light of this world. And you know, light can't be hidden. The time I was telling people, some of us can't be hidden. Because if you want to hide me, you get burned. Because I'm a light, right? Light burns. I hope you know that. So walk as light, not arrogantly, but with humility. You know, Jesus teaches us a lot of things. So high up there, but at the same time mingling and taking on things that appear so low. Doing something that so low doesn't make you any less of who you are, but it actually exposes you. And somebody can be ministered to and be encouraged because of your humility. So always put on that face of humility that will cause you to go miles. So thank you so much. There's a lot of things that we can actually share. We have our registrar on, and he's going to, he has a presentation. You know Dr. Katumba. The pre-interns, who might not know him, he's the registrar of the Uganda Medical and Dental Practitioner. And he is a very passionate gentleman. When you meet him, many times when you read, they say, oh, counsel, you might get scared. But he's a very passionate and he wants things to get better in this country in terms of the registrations, your well-being. He's actually an advocate for the medical field. And Dr. Katumba, you are welcome to speak to us as we listen in. We apologize, we overstretched a bit, but please don't log off. Let's listen to these words of wisdom, because this is very, very ethics is key. We don't want the lawyers to come chasing after you and make you poor. I hate poverty. So we don't want you to be made poor, right? Because they are chasing after you because they are not diligent. Dr. Katumba, you are welcome.
Hello?
Hello, we can hear you.
Yes. Can I start?
Yes, please.
Good morning, ladies and gentlemen. It's afternoon. I'm very happy to be invited by the Christian Fellowship, the Uganda Christian Fellowship, to talk to the young doctors who are coming to the profession. I've been given a short time, but I will use it very profitably. Next slide. Next slide. Yes, I just want to tell you that where you have come, it's a profession which is regulated, and the regulator is called Uganda Medical and Dental Council. I'm aware there are nurses in this meeting. You have Nurses Council, the Pharmacy Council, and then the Allied Council. Continue. Okay, before I talk about the main topic, I want to tell you the mandate of this council or these councils, but particularly for Uganda Medical and Dental Council. We am the registrar. I'm Dr. Katumba Sentongo. Some of you have met me. There are 4 summarized mandates. The first one is to supervise medical and dental training and the institutions. We do it with National Council for Higher Education, and also we do with this African community. You have seen us coming there and imposing some sanctions on some of their universities. The second one is we register you. We register you when you qualify. If you are from the local university here, you are registered directly after internship. But if you are foreign trained, you will do some exams with us, written and practical. The third one is enforcing standards. Enforcing standards, there we register you, we license you every year, we inspect your facility, we coordinate CPD. Oh, that is under that docket. The last one is to, unfortunately, to investigate you if you don't do the practice properly. So you can be investigated in 2 areas. If you fail ethically, you have not done your practice very well, and that's what I would make the basis for this topic. And also, you can be taken on by this council if you are not fit to practice. Those are different. Fit to practice is if you are overridden by alcohol and drugs, or if you are physically incapable due to old age and whatever, and you fail to adhere to counsel. It's not a problem to be old, or you can be victim of drug abuse, but normally if it is reported, the council takes you on for guidance and advice. It only becomes a problem if you refuse, and that's when they can take disciplinary action. So those are the 4 mandates summarized as in our act. The act we are running is of 1996. So the council does not fight for salaries or welfare. It should be clear from the beginning. Can we go to slide number 9, sir? Number 9, slide next. These are the universities we have. Continue. Next slide. Next slide. That's what I've been talking about. Yeah. Yes, there. Now, I'm very happy to be in this conference because the thing that I'm going to talk about, it doesn't mean that you cannot fall as a Christian, but the Christianity in you can help a lot to sort out or to avoid some of the things that can really bring you to council. Council is a good place only to visit if you are asked as a consultant to help you or to register your new qualifications, but not for discipline. The place can be nasty, and what I'm going to talk about are some of the things that we can be careful about and guided by Christian principles. We can here avoid counsel on that aspect and avoid court, which normally these lawyers normally come and punch on cases which have been ruled by counsel to make a killing for themselves and a killing for their clients. Now, what are the issues that counsel takes as professional misconduct under docket number 4? The first one, the practitioner obtaining license fraudulently. Recently, we got a young doctor who wanted to quickly enter internship and came with a forged transcript. He's a qualified doctor, but surprisingly, he came. The doctor came with a forged document because he wanted to, and surprisingly, he told us that he was Christian. So this is an offense at the council, and as Christians, which I am one of them, you should not ashame yourself and the faith really. That. 2, as Christians, we are not supposed to operate beyond the scope of practice. You are qualifying now as medical officers. Medical officers, there is a scope which we are going to teach again so that you know your limits. But at the moment in Uganda, medical officers are handling the general cases, but cases which are clearly beyond you, neurosurgery, removal of prostate, whatever, those should really be out of your domain, because you have found some, especially young doctors, are telling patients not to go to specialists, saying those are very, very expensive, don't go there, we do not afford. Though sometimes you get some seniors also telling people not to go to junior doctors that they don't know. But you will be safe as a Christian doctor to know the limits. You have been in school, you see what the specialists do. Don't do what is not in your scope, because it will be regarded as incompetence and negligence on yourself of handling a patient whom you are sure you don't have capacity. Somebody has a broken bone, you have a small clinic, you don't have an X-ray, it's an open fracture. What really are you doing with that patient? The third one I've talked about, we have recent, and you are aware, as interns, some of you are failed to complete because you have been overridden by alcohol, drugs. This really should not be under a Christian doctor. But those who have been a victim, those which have been reported, council has assisted to bring those people to the fold, to get treatment, to get care, to get rehabilitated, so that they can come to the profession, back to the profession. The ratio of doctors now to patient in Uganda is 1 to 30,000, and for dental surgeon, 1 to 200,000. So we cannot afford to lose any. But you have to, if you're a victim, you have to abide with the guidance so that you are not deregistered or you are not taken action against by this council. So those 2 areas are the ones which have affected the young doctors. Of course, there are those who have been mentally disturbed. Council has tried, but those who have refused, unfortunately, the council has taken action. Some of you might have heard of a senior doctor who was removed off the register from Arua. So it might not be a problem. For example, if you're a senior doctor, you're a surgeon, You are now getting tremors. Of course, council will not allow you to practice, but it will not deregister you. It can, for example, if it cannot heal, it can ask you to reduce scope. You can do consultation and you don't go to theater. But what is important in that aspect, that the main dockets, the main areas of alcohol, of drug abuse, these ones, as Christian doctors, here we are not expected, because if you're a Christian doctor, people are also looking at you a lot. I took time to talk to this doctor who told me he was a Christian, he had presented fake papers, and you could really see no reason for that, because he had a qualified doctor, and he had no business going to NASA creating a certificate because he wants to enter internship quickly. You are qualifying as doctors, but there are a lot of responsibilities in this profession. Sometimes, and you know, doctors have taken over patients, even in the government hospitals, and say, this is my patient. If you do, there are some responsibilities which are involved. If he is a general patient coming to a general hospital, a private hospital, that patient can be handled by any person there, from a specialist to a nurse. But if you hang on a patient, like in some private hospital happens, and you say, this is my patient, if you are to leave for any reason, or you are sick, or you have an assignment, that patient should be handled by a person of the same capacity as you. So medical officer is a medical officer. Don't delegate to a clinical officer, okay? If you take the response that this is your passionate patient, that's what I mean. Because this patient can take you on, that you give him or her somebody who is incompetent, and there have been several cases here where doctors, especially senior doctors, have suffered. The idea I want to welcome you to the profession to avoid that, because that's where you are coming. The next, sir. Next slide. Yes. Of course, as Christians, that first slide is very, very important. This is the profession where you are not supposed to discriminate against any person due to race, creed, color, or ethnic origin. And of course, as Christians, that is a given. The ethic principles here guide you, that you give allegiance and support and commitment to your patient, so they don't expect that you can be discriminatory to any of your patients. And as a Christian, I don't expect that, and I uphold you to do that. It has happened in some countries. I talked about some time back about the South Africans who were rapists, and they wanted to do research on Africans without authority. They wanted to provide the wrong diagnosis or postmortem reports for people who have been killed by police and the army. These were forbidden, and you should not be part of those who are in that type of behavior. Now, abandoning and neglecting a patient in need of immediate professional care. Yes, this is very important, and Council has insisted in the ethics, Code of Ethics. I want you to read the Code of Ethics. It is on our website. I can provide it to the fellowship again so that you can read it. Even in the private sector, there have been instances where we have had even Christian hospitals asking for money before people can be treated for emergency cases. It doesn't mean that you should not make money, but the ethic principles here and the Christian principles, you treat an emergency and then you can refer to a public hospital. You don't ask somebody who is bleeding that you give me money before I treat you. That is very, very unconventional, unprofessional, unethical, and obviously non-Christian. So guidance has been given, and I guide you that professional abandoning patients who are immediate care is a very, very serious offense. Even during the strikes, I've seen the organizers make sure that emergencies are handled. That's really very good. Those of you who are following, in Kenya, there was a strike some 2 years ago, and the doctors didn't provide for emergency. The very doctors lost parents all over because you can be in a strike in Kampala and you are born in Arua. Your colleagues are also put tools down. By the time you realize your mother has died. So emergency is very, very important, not only for strikes, but everywhere you are on the road. Even if you have money, the money can be stolen. And somebody in a Kaoloria to ask you money when you have to really be very unprofessional, as I've said. So it's a very important point here you need to follow. The third about consent. Consent is something to do with the independence of a person, integrity of the person, privacy of a person. The cases which are coming to council are basically around there. The on consent and the records, which is the last slide, last point. Make sure you have consent of the patient, whatever you're going to do. Gone are days where we assume that if a patient came to Mulago Hospital, to Mbarara Hospital, to Lacho Hospital, he has consented to everything. The new principles are that have consent all the way. This business of taking a patient for a ride, because patients now know their rights, people know that consent has to be got. Doctors have been brought here and they've been brought to council because of lack of consent. And I want to warn you as young doctors that the patients are called clients. The patients are not your friend. The patient is not your friend. So don't do good for a patient when you are not protected by the law. I want to repeat that. Don't do anything good for the patient unless you are protected by the law, because the patient, if things turn, will never protect you, even if he is your friend. Okay, so it's very important that you have consent and written consent. And this consent widens to cover areas of refusal of operations, okay, and refusal of discharge or refusal of procedure. So if a patient, you have guided that you need an operation, the patient refuses, don't abuse the patient. Refer to somebody senior. If everything feels right, you'll be covered. If you have referred a patient, he doesn't have money and whatever, or yourself, you are in charge, you don't have an ambulance has no fuel, please write. Because so many doctors have suffered, they have referred the patients, and patients refuse. And when the patient dies, then they said, oh, they refused to refer him. They wanted money. You didn't write, you'll be in trouble. The patient will never protect you. Or you have referred the patient and she goes away, but you didn't write. The patient says, oh, I was just away from the hospital. So those are different elements of consent and also engaging patient. Engaging patient so that you get the best out of him or her, but also protected. There's this point of handling patients with dignity I talked about. Explain to the patient what you can. If a patient refuses your treatment, don't abuse the patient, whatever condition, because they have been having in the past defined midwives, they're abusing these disabled people because she's now having a 7th child. Please don't. If they are asking for their records, give them their records. It is not your record. Because in the past, you have been, oh, if I tell the patient that he has cancer, he will die very quickly. It is not your disease. It is the patient's disease. Patient has a right to get information. However stupid the question is, you are not supposed to, as a Christian, of course, you're not supposed to handle the patient in derogatory manner. The last point in this area is about records. I talked about the record of a new intern who brought us what. But what is much more important, make sure that you see the patient you are writing records for to begin with. When a patient comes, make as detailed records as much as you can. We are having cases here in council where people went to do an abortion, which I don't expect of Christian doctors. They went to do an abortion. And when a patient was reported to the senior doctor, who was a gynecologist, to handle emergency care, he didn't write that the patient came with this condition. The patient died in that place and they just picked up the obs-and-gyn man. So make sure when a patient is in your ward, patient under your care, write everything. Because people have been suing hospitals, they've been suing doctors of non-treatment, and the doctors have been coming to council, they've been coming to court, tell people, I treated that patient. Well, even the nurses can verify that if you didn't write, you are really in trouble. Secondly, to do with records, don't fill records for people you have not seen. This business of filling records for students who are going to school, medical forms you have not seen, people have been embarrassed. You find a doctor, he has signed for somebody, in 2 weeks the child is returned, pregnant, and your signature is there. These forms for driving permit, we are now working with them, with the police and Ministry of Transport. Doctors have been signing without seeing people who are driving these cars, and they are knocking us left, right, and center, and we are the ones who did the signature that the man is fit to drive. Insurance, people want to get NSSF. Some doctor signed in for somebody that is 60 years. When NSSF disputed and they brought the case, you ask the man who was, the one had wanted to take on the NSSF doctor who had refused that he was 60 years. When you ask the man when he finished P7, because he didn't expect it, yeah, he said he finished it in 1982. And this is the man who wanted to present that he was 60 years. But the doctor had signed it. There's some even bigger nasty cases, which if we had time, I'd have told you, which have costed doctors their citizenship in other countries, their jobs. You have people who are now going to Iraq, people who are going to the jail, they get insurance. But Africans don't get sick very quickly. So when they come to Uganda, they come and want to get that insurance money. And doctors, right, that they have handled those cases in the ICUs, when actually the doctor is having a 2-room clinic. I don't expect to hear this with the Christian doctor. Next slide. Next slide. Now, I also want to quickly say like this. Doctors can be taken on by council, but also court. But the procedure is, if you have a complaint against the doctors, you write to the council. Council does not pick cases on TV and radio and the street. Because I've seen, what is the council doing? No, we don't, because you have to have, you cannot be the accuser and the judge at the same time. And you are given, as a doctor, if you are taken on, you are given 2 weeks to present yourself. If the first committee thinks that you have a case, it will be called a tribunal. But if there is no case, then it will be referred to the patient, and the patient will be told that this is not a a case that council can handle. I want to tell you that half of the cases that come to council, half are dismissed by council. Those of you who are asking, how does the council help us? This is how it helps you, by refusing people who want to sue you in cases which are not professional. If you have bought a building or you bought a patient. So we are protected by a patient, by a council guiding the patients not to sue you. Last slide. Next. Next. Okay, this is the last slide. Having talked about those cases, council, if it passes through those procedures, it can give you the following penalties. The first one, depending on the gravity of the matter, it can be verbal warning. It can be written warning to you. Your warning can be sent to the employer. If you have a very serious employer like UN, they can delete you from the register. You can be put on probation. Probation is bad because it means that, especially if you're in private sector, you cannot work. You are working under somebody. 2 years ago, there was a senior surgeon who was put on probation and he couldn't get any job anywhere. You can be suspended from practice for a period of years, and you can be erased from practice forever. And I also want to tell you that in this profession, we are obliged that if you have a case, especially if you have lost it, we tell all the councils in the world, 248 of them. So it becomes difficult for you to work. The objective of this presentation, as I end, the objective of this presentation is not to threaten you, is to tell you that most of the things that we have talked about can be avoided, and can be avoided much more by Christian doctors. And I wish you very well on this new profession we are coming, and you only interact with the council in good cases, guided by Jesus Christ. I thank you.
Thank you so much, Dr. Katumba, and thank you for clarifying that question. How does the council protect us? Indeed, there are many ways we can be protected. Even his presentation, actually, it's aimed to protect us, to know the loopholes where we can be preyed on, such that we can avoid. But it's been a great session. Once again, we apologize. We've stretched it.
Isaac, we can't hear. Oh. Isaac, are you waving to us?
Oh, what happened? Yes, so we would want to bring this to a close. We've taken note of the comments in the chat. We're going to have more than one of these. It will happen, and we'll plan and we'll communicate accordingly. We appreciate people who responded in time. There is a YouTube channel. This has been recorded and it's going to be available. People can actually replay and listen in because sometimes things can be a little fast. So you can always listen in the comfort of your room and send to other people also who are not able, because we know some people are actually on call duties here and there. But if it has benefited you, please send these links to other people. And those who have not listened, like who are not registered, you can actually register in the chat room. We'll share the slides from this presentation, such that you can always go back and read through. And several contacts have been shared. Please feel free to reach out. We appreciate medicine. It's a family where we can actually support each other. Don't suffer alone. Don't suffer solo. Allow yourselves to tap into the help that's available. Peer-to-peer support is available. Please, we encourage those ones who are just joining the internship. Can you please work out a way where you have a forum where you can communicate, make friendships. Some of these can form lasting groups that can help you grow. It also gives you a sense of accountability. Those things that people see in you, when we are drifting off, they can be able to actually tell you confidently, but in love, that you know what, we say, oh, this is how we do things. Please allow to be rebuked. It's part of growth, but allow for people to input into your lives. And where you have questions, reach out to your immediate supervisors. Where there is no clarity, seek for it. Internship should really be memorable, and it should be a phase where you gain the confidence, the practical bits that you've learned, to be able to start a journey with ease, and you can be able to actually benefit so many people out there. So those who are in the middle, we celebrate the milestones that you've achieved, and we wish you all the best. Please finish strong. Don't get too tired and fail to finish. We want you to finish strong and be expectant, because the future is bright, right? We appreciate the rise that came recently. Use it. We shared some matters on finances. Invest, plan well. Eh? Don't waste these resources. It means a lot. Many of us actually we made mileage as interns, and those memories are really they resonate, because you work so hard. If you squander your earning, you get more tired, because there's nothing that you have to show. So use it well, seek financial guidance where it's needed, and don't be allowed to be cheated. We know, and we are praying as UCMF, we stand with all the interns, the current and those who are coming. Your requests, every morning we raise them before God. And for us, actually, the breakthrough, we attribute that to God, that He answered. He softened parts that people are able to respond appropriately. So prayer has a place, and the good thing as we pray, there are leaders who listen, because God speaks to every human being. The Bible says he directs the heart like a water course. He can cause people to change their minds on things that might not be appropriate, but always seek that guidance and that counsel, such that you operate in sync with what God wants to do. Because, like I told you, your lot is secure and He means well for you. So approach these opportunities with gladness. There's a reason why you are a doctor. The reason why you're a nurse. There's a reason why you are that pharmacist, to make a change and to benefit many. Yeah, so we're going to end here. Any remarks from anybody here? Yes, yeah, so we have just some brief closing remarks from Patrick, but it was such a wonderful opportunity to participate in this. It's a start. Many await us, and we are more than happy to work with many of you to make a difference. Be blessed. God bless you so much. Patrick, hand over to you for closing.
Let's give Isaac a round of applause. Thank you so much, Isaac. I just want to pass a lot of thanks to our here, much those that have been able to make it physically. We're grateful. Thank you for joining.
Natasha, there's no Bible, and I want so such legacy and reputation of you is just go for long. Thank you so much once again.
Thank you once again. Our friends online were not hearing us. I was saying that a few years from now, we will hear comments that I want to go to this hospital because Dr. So and so is there, and she is the best surgeon in Uganda. She is, or he is the best obstetrician, or he is the best medical surgeon. So I want to be seen by such build reputations as opposed to short-term gains, build legacies. We wish you the best in your careers. Start to fly. Hold on to those words of wisdom. They will guide you through the path of life. Thank you so much, those that are online, those that are here, the IGT, and everybody. Have a blessed day. God bless you.
Thank you. God bless you too.
Thank you, everyone. Thank you very much for participating.
All right.